kinakain yung kapiraso dito? Nasa baba po. Bakit hindi mo yung kapiraso? Kinakain ko yung kapiraso. Ano ang gagawin mo doon? Kagabi, humihingi ako ng mainit na tubig. Bigla na wala na kayo. Ganito, naghahanap pa kayo. 9:30 pa lang, wala na. Ba't gano'n? Hinihintay namin yung hot water na hinahanap kayo doon at makasala na kayo. Anong oras ka pumunta kay Abby? Ba't nakalimutan mo yung hot water? Uminom mo sa akin. Yung ano yung yellow slippers at ibang mga bagay na sa ibaba. Pera pa ba? Kaya nga, i-action na rin ako. Let's go.
Joey, morning.
Good morning, Giselle.
Yes,
Yeah, let me just check, huh?
you're good.
Can you see me?
Yes,
Diba? Okay, can I just check the share screen?
sure.
Uh,
Let me make it multiple.
Sige, ano ka lang, ha? Let me just pull it down. Documents, presentation. Okay.
Try it.
Huh? So let me check. Okay, share screen. Shit, where is it? Here. Can you see it?
Yes,
Okay. Okay, so we're all set.
we're all set. So the way we'll run this is for you to give the talk. How long do you think you will take?
Yeah, probably about 30, 45 minutes.
That's
Uh, and then we'll open it up to questions after that.
okay.
And discussion. I'm interested in all the questions and the discussions.
Yeah, I think the Earth D people will join. Tito Alika, your
Okay, great, great,
engineers.
great.
Yeah,
That's good, that's good. How are you?
I'm good. Quite busy with this past. I'm good. It's good.
Yeah.
Well, retired, so I have time. But I do have things in NAST, and I still have
Oh,
my
yeah,
project with the PCHRD, although I'm no
yeah,
longer the leader.
yeah,
But so of course, they're expecting us to commit candidates, drug candidates. It was real little bit unrealistic, because it's not been so long that we've been working on that, but I am focused on the conoidean peptides, the common
yeah,
peptides now. But even in the States, it's still at the developmental stage. And then I was uh, telling them 2 years ago, I brought Toto Oliveira to PGH to try to consider the most advanced conopeptides already
yeah,
approved.
yeah,
And there were
yeah,
PGH MDs interested.
yeah.
So
You
finally,
have, you, you have to go to that and immediate, ano na, yung clinicals.
exactly. So now, well, last December, our last fireside chat was with Sec Boy. And then this is the next one. So you're the next after Sec Boy.
Yeah,
And he announced there that the UST would be willing to support projects that were not originally funded by them. So that's a cue to me that the most advanced gonopeptides of Toto Oliveira might be considered. So now
yeah,
Ami Guevara and I are talking. We have signed an MOU with the DOST
yeah,
because they're actually relying on a lot of our members. Even for the African swine fever
yeah,
problem.
yeah,
Just got it from Homer Pantua. You
yeah,
might know him, no?
yeah,
In tech, but he's also already uh, set up a business here, vet med diagnostics
yeah.
business. Anyway, I guess they see the value of our scientists and engineers based abroad. Dapat naman. Di naman pwedeng yung tayo lang andito, di ba? So
Saka
anyway,
hindi ano yan eh, in this day and age, it's
uh-uh,
very easy to do, to do cross-border collaboration. That's not a problem.
oo. So that's what's happening now. So, I even brought Toto after giving a talk in PGH. So, about 2 years ago, I even brought him to Taiwan, to Academia Sinica.
Yeah,
Kasi tayo nga ang Academia Sinica ng huge biotech center
yeah,
for commercialization.
yeah. Giselle, what we can do, and this I've been talking to some people on this one. If you look at the pandemic, there are opportunities that have been brought about by this pandemic, by the quarantine. And one of the things I think that will continue to stay, despite even after the pandemic has subsided, is now yung it's electronic electronic education. No? So you can really, I was talking to Ray about it and he fully agrees with it. you can actually create micromasters programs, you know. So he calls it micromasters, no? Na short courses, you know, similar to Coursera, similar to a certain extent the great lecture series of yung sa teaching courses yung sa Audible, you know. Pwede yun eh. Kasi now, tapos we can tap the professors, the Filipino professors, the Filipino scientists abroad, you know, and come up with courses here, short courses. And it can be co-branded, let's say, with UP, with Ateneo, with whatever, similar to what Coursera does, no? Where you have courses being given by Coursera, but co-branded by Stanford, by Yale, no? So pwede yan eh. And you have people, ang target ano mo, you have people already working. Kasi the problem here is after you graduate, wala na eh. Diba?
Absolutely. Ako, I'm a believer in that.
So maybe we can, that can be a project.
Yeah,
you know,
sure.
we can work on it. And it's, you know, it's not going to be we'll ask people to pay, you know?
Yes. So good person to organize this. Actually, we're on it already.
Yeah,
But first
perfect.
at the secondary level. So you might note we have an S&T, Human Capital Development paper.
Yes.
Secondary level ang focus din namin. Syempre tertiary rin, pero PhDs muna, research. And then third focus, of course, is stronger linkage with industry. Pero sa STEM education, ang leaders talaga dyan, si Father Ben, and then CP David, and then myself. So we have a committee. So we're actually coming up with these materials as you described. But I also believe in what you call medyo professional masters, pero siguro mas maikli pa doon. Short-term courses na nga eh.
Short-term courses lang.
At
saka to make sure also that our scientists continue to interact with each other even if they're in industry na. So may interaction yan eh. And the problem kasi is that you know, we're all leaving it to the companies and to do their own pharma, no? to do their own teaching. Remember, and you know, for the universities, you have one big asset that you're not utilizing, eh? And these are your star professors.
Exactly.
Diba? So identify the star professors, etc. And of course, you know.
Well, if you want to, spearhead that, because anyway, Unilab Foundation is STEM education. You know, because of this UP D&D, problem, the professors emeriti of UP came together. So, and we are being advised by Solita Monsod to organize as, a real parang group, no? So those are the ones you can immediately tap, because the ones in UP or even in Ateneo, oh my gosh, they're really so stressed about the new online delivery of the course.
Yeah. You can professionalize it, you know, you can help them actually and bring the, you know, kasi problema iba-iba yung quality eh, ng ano eh.
You know,
so you can help them by yung audio, the video, really come up with a studio where they record their lectures. And maganda dyan is one recording and then all they have to do later on is stay at their homes, no? For the Q&A portion. So pre-recorded na yung lectures, di ba?
Yes.
And then it's the Q&A na lang sila na they have to stay, di ba?
That's what we did in our 40th Congress or our conference August.
Yeah.
But also to affirm what you said, one of our members is a member of the Engineering Professional Regulations Commission. Based in Mindanao siya. And he's saying that right now, their faculty and scientists and engineers in particular, they get their training from whom? From the provider, from the equipment suppliers.
Yeah.
So this is counting mostly on the professional organizations.
Yeah.
Wala namang makapagay na maayos.
Kahit equipment suppliers, dito na yung training para even those who are not yet, we can ask we can ask Waters, we can ask lahat, no?
Oo din. Pwede din yun, no? Pero syempre, parang sinasabi lang ng member namin, I forgot his surname now, medyo, it's syempre focused on...
of course, on their products.
Mas gusto niya, they preferred to get those lectures, as you described, from the professional organizations.
Yep.
Who would the lecturers be? Sana nga yung mga PAASE members and multi-institutional, hindi lang. So, in fact, we have a PAASE. We have the same idea. We already have a YouTube channel. See?
Yeah.
And we're organizing. In fact, tonight we have a meeting with our Vice President Mario and my website manager. But the idea is now to organize all our lectures, our talks in that conference and through these chats and Friday webinars, because we have a webinar every Friday
Yeah.
along the topics of the 17 SDGs. So in fact, we already have the enough for the 17 SDGs.
Yeah. The
So,
beauty of it being pre-recorded also is you can edit it. Eh. You can edit it. So kasi may ano, para mas compact, no? Mas ano yan.
so if that's actually what we're planning to do, we have a group within the PAASE on education. Okay, so we're supposed to come up with a plan. In fact, our first fundraising or call for applications for funding would be to produce STEM materials, pero not
Yeah.
yet at the professional level. But
Yeah.
the next priority right now, it is really secondary education level.
Yeah.
Okay. So,
Yeah, that's okay for the secondary, but siguro I'll be interested in the in the professional, really making it the professional addressing ano. Kasi ano na lang, like pharma,
mm-mm.
a lot of companies would be very much interested there. Right now, they're relying on FDA, etc. Wala namang ano yun.
Wala talaga.
No? So if you can have, halimbawa yan, madaling ano yan, no?
So
I mean, there's something that can be done. Yeah, but make it transformative to micro. Maybe you can discuss it with the universities, no? If that can be co-branded, because that's the ano eh. I mean, if it's just an organization, people will not ano eh. So if it's let's say co-branded with UP or with the US university for that matter, no? Malaking bagay yan. Or co-branded with I don't know, AIM or whatever, or De La Salle or Ateneo. And then you get the star professors pre-record their lectures, no? Ano yan? And that's it. And we can even have the professors from the US, di ba? Yung mga Filipino professors. We can in fact not limit it to Filipino professors. Eh. We just had one with Makati Business Club, no? Which Unilab Foundation through Lilibeth, worked on. And we had four professors, a series of lectures, 4 professors yon. One from MIT, one from Yale, one from Harvard, and the other one from UPenn, from Wharton. And it was done, they talked about topics that they were working on.
right.
So, and I
Science and technology, these professors.
this one is more on more on management, but we can have a similar one on science and technology.
We've been wanting to have a chance to speak at the Makati Business Club or the MAP Management of the Philippines, or kahit Rotary, or so we're trying to do that through the foundations like the Romulo Foundation. So we're linking up with them also. Pero that's a really good idea.
But if we can pre-record everything, so that once, let's say, somebody from the US talks about, halimbawa, Dado Banata, halimbawa, talks about then pre-recorded na lang yon topic niya. And then we can from one group to another, so yun lang na yun. And then if Dado wants to stay there, and answer mga questions and answer mga Q&A, then open forum, then he goes. So para yung mga speakers natin and also the professors, para they don't have to repeat themselves over and over again. Every forum, meron na naman silang panahon.
So in our conference, maraming ganyan.
Ayun. Yun pala. And then we can edit.
We can edit.
Ask for the opportunity to edit, the right to edit. Kasi marami doon, syempre may mga lapses, may mga di ba? And then it will be shown to them, the final form, before we,
Okay, would you like to provide a little bit of support for us? I mean, I think the first thing we would
let's discuss it kasi it can be I can have some funding made, but let's discuss it paano gagawin, and then the topics, etc.
Let's meet with Lilibeth, and then I think I would like your suggestions on a list of topics. Umpisahan muna natin. Okay, this module and then that module. Ganon muna, and then we will look for the speakers.
Yeah, sa akin, I can go with, I don't have to go to Lilibeth, kasi si Lilibeth, may rin yan, syempre may funding yan. So I'll look for the funding myself, internally within the RightNet group, Because I have my own funds, discretionary funds there no, na I can work on. No?
Oo.
So, yun ang ano doon.
No, because I thought pagka
Because
having
Lilibet is focused on on STEM sa secondary education.
okay,
No?
all right.
So I wanted to be focused naman on the professional
Wonder
professional.
we really have that goal also, Joey. So it's just a matter of finding the right partners.
Yeah.
As na naman yung PAASE, hindi naman maraming pera yan eh. So,
Yeah.
but we're raising funds.
Yeah.
David, he was able to raise naman 100,000 pesos from the Stanford group.
Yeah.
He, organized a tech webinar with leaders from Amazon, Netflix, Google, Gcash, and Grab. So mga
Yeah, but we need to move beyond webinars. We need to move beyond that. Ang sa akin, mas formal courses, na that we will pre-record, no, and then we will offer. Now, I mean, it has to be hindi pwede na libre na naman eh, no. It has to be something that people will need to pay for, and then we work with companies, no. We work with companies and tell them, okay, what are the topics that you want, no, and then we will get the professors for you and come up with a program. Kasi sa ngayon, yan yung link talaga ng industry at saka ng academe, no? And then it's not limited to Filipino professors, you know. We can have our Filipino sa PAASE, yung mga kaibigan ng mga Filipino professors abroad, they can even suggest, no? So the beauty of this is it cuts through borders. You don't even have to invite them here anymore.
No, absolutely.
Professors, they can pre-record it.
No, that's what's happening now. But
precisely. But we need to formalize it, to make it formal and transform it into a sustainable activity, no, for PAASE.
Well, in that case, kailangan ng say course evaluation. So you attend the course, but for you to gain credits for it,
yes, may exams, may evaluation, may exams. Similar to Coursera, if you look at Coursera, you have to now you have to have exams, no? May exams ka doon. You have to pass.
And then
the given the certificate.
The student can go at his own pace, right?
Yes.
So, we are familiar with that. It's just that right now, ang dami talagang gustong gawin ng PAASE, to be honest. Ang dami talagang ginagawa na. And so,
you just have to
if you are
prioritize,
be our partner with it, then that would be good. So,
you have to prioritize, if we can prioritize that one, then mas maganda yun. If we can focus on that one, if you can have somebody I can work with on that one in PAASE.
We will start first with pharma. We'll start first with biomedical.
Let's start with not pharma per se, but something on biochemistry, etc. Mga ganyan. We can start with natural products, for instance, kasi ang dami-daming a lot of people working on natural products, etc. Tapos sabog-sabog naman tapos kanya-kanya ang pace, hindi naman alam, di ba?
Your take on that because you're in the PCHRD, but I honestly don't know what is the status of the Tuklas Lunas program, but it's a very sensitive issue because
I know because I've been very critical of it.
Ami Guevara is still the head of it, and then she's now very active in the PAASE. And in fact, in our MOU with the DOST, I invited her to be a member of the committee just to move things forward fast. So, we have to help. But if they do not let us know what is going on talaga in the Tuklas Lunas program, they talk about so many candidates that they already have 50.
Wala yan eh.
So sad to hear.
Ang dami-daming candidates, imbes na mag-focus ay ilan na
How characterized are they? So, between
sorry, I have a slide here, Baka, I have a slide here. Quixotic push for drug discovery,
I know you've always taken that view, but that's what I'm telling you. Finally, I told Ami, we had the 2-hour talk, and we're going to work together to move forward now, whatever is most advanced.
Yes. Kasi ang dami. Like, halimbawa, Giselle, one of the pinaka-critical, halimbawa, I have a very, very critical of that, you have projects which are being presented and they want to it's a product herbal that they want to look at the anti-infective properties, cardiovascular, anti-cancer. Sabi ko, You just choose one because you cannot go and test that for all those diseases. You have to choose one. Which one is the best? Which one do you think, based on the structure of the product, based on the science that you know about the product, which one? Is it anti-infective? Is it as a cardiovascular product? But you
Ano
cannot
sabi
have all.
ano
Walang
sabi
focus. Ganun pa rin yan eh. Parang sabi ko hanggang ngayon ba naman, nasa ano pa rin tayo? Ano pa rin tayo, parang shotgun pa rin, di ba? There are some who actually have gotten it, but there are some who are still parang, are you guys probing?
I mean,
Hindi niyo pa
siguro,
alam kung ano yung focus. You
so
need
evaluate
focus kasi it's very expensive.
Oo.
We need to focus, and that's what I will reiterate later on.
Oh,
We need
good.
to focus. If you want drug, the reason why drug discovery now is quixotic, is because you enter into that not fully looking at the entire pathway, and you have to understand it's a long process, very long process. It's a
Yeah.
very expensive process. Somewhere along the way, you will need to partner with big pharma,
Of course.
di ba? Ano yun? But to do that, you have to focus. Di ba?
Yes.
Okay.
Yeah. So I think we're one along that line
Yeah.
of thinking, and I just wanted to have a chance, to get the most advanced compounds. So
Yeah.
in the
Yeah. Focus on that, and then do the clinicals, initial clinical, pre-clinicals, di ba?
Exactly.
Focus on that.
Pumunta na nga kami kay Toto sa sa PGH. Meron na mga doktor na interesado.
Ayun.
Ito na to. Okay? So I affirmed it again with Toto, Contulakin G. Okay?
Oh.
Neurotensin analog. So it's
Okay.
working, no? And then we have one discovered by my RA. It's also moving very fast. It's naman a somatostatin analog. We call it somatin. So focus on a subtype of somatostatin receptor, which is
Yeah.
linked to inflammation.
They
Okay?
focus on that. Inflammation is a big thing now.
Of course, that's why sabi namin sa COVID, importante yan.
Oh.
And,
I
I have
mean, our resources, drug discovery is very expensive. So you need to focus. Hindi pwede ng lahat ganon.
I'm going to
Okay.
I'm going to Viber Ami and ask her to attend. So say what you want.
Tama, ano yan ha?
Sige. Alice here.
Hi Al.
Morning, Joey. How are you?
Good morning. Good morning.
Busy kayo, ha?
Oo nga eh. Grabe.
Sobrang aktibidades.
Well,
Are you-
aside from the day job, you have the night job, which is the vaccine, no?
Yes, yes.
Which is not really, it's not even a business, no? It's really just to
Humanitarian.
make sure, just to have options, no?
Yes.
People might ask about that part, huh?
Okay, I'm okay. I'm okay to answer that.
Mhm.
Latest report na naman, yun daw sanang Pfizer order, hindi dumating. Tapos now we have instead Sinovac. No, you ganoon? No, it's all over the news, no?
The problem really is that there's a lot of people. It's a lot of optics going on, no?
Mhm.
Optics going on, and unfortunately, some of the optics are coming from people who are not even involved.
Yeah,
Di ba?
for sure.
Who are not even involved. Para God, But Galvez, you can Galvez. Galvez, you can trust Galvez, no?
Yeah.
Galvez is somebody you
Can
can
be trusted. Me also.
he listens to the scientists,
Mm.
He listens to the VEP. He's been
Mhm.
listening very much to the VEP. So you can
That's
trust.
good. But at least you have a good guy trying
You
to...
have a good guy on top of it. No? The only problem is daming nakikisaw-saw.
Exactly.
Remember, 2022 is election year, so
Yep.
it's around the corner, no? So,
So did you watch the video of Father Nicanor Austriaco? So this guy who's a PhD in moral theology, but also in
Yeah.
moral.
PCBP.
He's
And
now
the-
visiting professor in USD. I thought he did a good job. Rank
Yeah.
why even 50% efficacy vaccine should be considered. Di ba?
Yeah.
Yung ganon. I mean,
Well, people forget that we have flu vaccines which are only 60% efficient.
yeah, right.
I need to be reminded of that too.
Need to be reminded of that, And all this efficacy, are all in the context of clinical trials. Pagdating sa field conditions yan, babagsak yan.
Mhm,
I
mhm.
Especially if you have a vaccine that needs special handling.
Yep.
The reality is, how many hospitals can handle ultra low
Yeah.
temperatures? Wala. Di ba? It's
Yep.
only RITM and I think Zwillig will have. So you will have to need
Cardinal Joey said,
maraming ultra low sa lab.
a
Pero
lab.
ginagamit namin for, of course, our
Oo.
samples.
Hindi mo naman pwedeng gamitin yun, di ba?
yeah.
So deployment is another thing. The more difficult part is not actually the acquisition. The more difficult part is the
Yes.
deployment and the administration. Remember,
Yes.
you have 2 doses, huh? 2 doses for all vaccines.
Except
So how
for
do you,
Jay
how do
lang
you
is
make them come back?
So that's what we'd like to hear from you, Joey. In the States or from our PAASE members, iba-iba. Pagka sa isang state, very efficient ang kanilang administration, distribution,
Yeah.
administration. Sa iba naman, palpak.
Even in the US, we all talk about QR codes, etc. Even in the US, in Boston,
Oh,
it's papel. They're given papel.
Yeah. It's a card.
The reality is, this is, uncharted territory for
Definitely.
most, especially for us, no? But we have immunization, public immunization, but those are focused on kids and only a small fraction of the population. So sa akin, ang mas mahirap dyan, initially, sa akin, ang mahirap dyan kasi, knowing us Filipinos, ang mangyayari dyan, trickles yan at the start, and then biglang nagsak. Especially since there is a talk about in the Senate, and then there's a bill being, and I think that will be passed, no? That will require parang vaccine passports. When that is required, expect everyone now to start looking for the vaccine. Right now, there are a lot of people who say, I'll wait and see. Even some of the doctors are saying, wait and see, wait and see.
yeah.
Pag yan
Imagine
later on require na, sabay-sabay yan. Diba?
I mean, parang it's a matter of trust or belief. I don't.
It's trust.
I mean, on the other hand, these are people who do not understand the science.
Yes.
And how this has saved so many lives.
Yes.
Decades, right? So kulang talaga ng scientific literacy. So Joey, your idea.
Saka yung risk communication. Importante rin naman yung risk communication,
Correct.
Problema na, how do you do the risk communication without scaring people? Diba?
Yep.
Yan ang
after the vaccine kasi, Joey, part of the
well, that was kasi na-politicize yung Dengvaxia. We're paying for the sins of Dengvaxia.
Exactly. So
We're paying for that, unfortunately.
Yeah. Exactly.
But hopefully, I'm still hopeful that both the economic requirement will motivate. Because at the end of the day, it's the gut that counts. Kung wala kang makain, you'll do whatever it takes.
That's why our focus is sa amin, we're focusing on the companies, no. We're focusing also on the MSMEs. Sabi ko ganyan, sabi namin ganyan, the big guys can take care of themselves, and they've taken care of themselves,
Yep.
They went with kasi those Astra and Moderna and Pfizer, they require down payment,
Yes.
down payment, without any indication as to when exactly the delivery will be. Now, most MSMEs don't have the money to do that, di ba? So, sabi namin, let's focus on MSMEs. After all, the economy of this country actually relies on them, no? And they're the ones who sit. Now, we're focusing on them for 2 reasons. Number one, sila yung
successful is joint consumption.
We're not requiring
Pero,
down.
Joey, I hope in
Second,
Joey,
we're
I hope
focusing
in
on companies because yun ang mas naramdaman nila yung impact of the COVID.
Yeah.
They lose jobs, they have to close, di ba?
So anyway, Joey,
Yeah.
you know about the Serum Institute of India, di ba? They had been featured as very critical in manufacturing the vaccines for the whole world.
They're 60%, and that's the reason why we agree to
Yes.
that. We know them. We've been courting them for more than 10 years.
Yes, that's why I
They're
know.
the world's largest vaccine producer.
Exactly.
So, ano yan? So,
Oo.
sila yan.
So, yung
So, they can deliver. When they say they will deliver, they can deliver. Kasi they have the experience.
Yan, lahat ng mga Pfizer, they're gonna try to get Serum Institute of India to
Of course,
produce the
Astra
vaccines.
is the one. Serum is the one producing Astra.
Exactly. So
For
I think
South
there's hope.
Asia. For South Asia.
And
Ang
you're
problema
familiar
lang, yeah,
landscape.
yeah.
Good
So
morning.
they're producing for Novavax and 2 other companies.
Morning, everyone.
Hi, good morning.
Dick, ayan na.
Hi.
Hello. Hey, Costa.
Good morning.
People are excited.
Okay.
Morning.
Morning.
Good morning.
Morning. Costa, Joey.
Buti. Hi, Dick.
Hello.
Si Bubot yata nandito din. Hi, Bubot.
Okay,
I saw Bubot as well kanina. So,
Yeah. Hello, Joey.
hi.
sige. It's great.
And you have any idea when the J&J vaccine is coming to Manila? From your
Wala
J-
pa eh. Wala pang balita doon eh.
Tean is a J&J fellow.
Who?
Hello, boss.
And
Yeah.
Villalobos. Yes, I'm sure they will cover the Philippines, but that they have, it has to go through COVAX.
COVAX.
Yeah, COVAX.
Naka-assign sa
So
COVAX.
we ask to communicate with them. Yung kanyang contact sa US, J&J, sumagot. At yun
Yeah,
ang ang sabi.
perfect. Yeah,
Sorry,
perfect.
hindi ko naka-reply directly, no? Pero thanks for that information. So, yeah, we should...
I hope
like-
J&J succeeds kasi one shot lang kanila eh.
Yes, they're the only
More
single shot.
likely it will. Yeah, more likely it will because their clinical trial also included the new variant in
Okay.
South Africa and Latin America.
Oh, that's good.
So I think monitor that please, Anne, for us, no, for the Philippines naman. And then, ayan na si Ami G coming in. And then also, I think Sanofi, you know, Joey, we have connects in like Sanofi. One of the top guys there is the son of our former professor in Chem. So
Yeah.
his name is Dan Hiro. So I think we should keep in touch with them, no?
Yeah, I think they're developing as well in partnership with one other company. You know, they're developing the vaccine as well. No, but at this time, kasi, you know, until such time that they have the vaccine, you know, it will be pointless for us to kasi remember meron pang baggage sa dalang Sanofi because of the
Merong baggage, that's true. Yan naman yan.
So let them be quiet for a while.
Yes.
Let them be quiet for a while, and you know, once it's done, you know, we need it.
Kasi this will be ongoing for a long time. Itong vaccine. So,
Well, if you want to see the silver lining in the pandemic, one thing naman that it did was really now people realize the importance of vaccine. Somehow it not totally negated.
Yeah.
But it's a counterpoint to the Deng Vaxxia controversy, di ba?
Well, the anti-vaxxers are still there.
Well,
as a decreasing number, no?
but you cannot. The problem is, you know, I cannot do, as I always tell people, you know, I cannot do anything about the conspiracy theories and etc.
Yeah.
You know, you're adults. It's up to you.
Yes.
But you know, this is what will happen. This is my fearless forecast. You know, my fearless forecast is, of course, governments will not mandate vaccination. I mean, it will be foolish for any government to do that. You know. But remember, what they can require are vaccine passports. You know, for you to do things, for you to travel, maybe for you to even enter a shopping mall. You know,
Yeah,
shopping mall. It's a private enforcement. It may be a private or local government enforcement. So, for instance, in companies, you know, companies may require their employees, and they can legally do that. You know, for them to have vaccine passports. Diba? Oh, ngayon, kahit na anong belief mo pa, Ano yan? It goes to the gut.
Wala kang trabaho.
It's not mandatory. You know, you can choose not to have it, but you know, you cannot do certain things. Yeah. That's how it will go. That's why it will go. That's why ang importante lang talaga is the risk communication. You know, we need to be able to still inform people of the risk, but not to scare them.
Okay. So we're
So
here.
can we start?
No, not yet. We're only 7. Let's be 10.
Ah,
Yeah. So Ami G is here.
hi
Bubot,
Mami.
Vic Ilag.
Hi, good morning.
Morning
Hello.
po.
Hi, Joe. Good morning. How are you?
I'm okay po. I'm okay.
Long time no see.
Oo nga eh.
I miss our meetings at
Yes,
DOST.
ma'am. Yes, ma'am.
Oo nga eh.
Pero ngayon, wala nang barriers. Ami, lalong pwedeng mag-meeting, di ba?
Pwede.
Yeah, right. It's true. In fact, in fact, I find it more efficient.
Yes.
Very.
And more tiring, more exhausting.
Yes,
Kasi
Joe.
back to back eh.
Kasi ang dami meetings,
Back to back
sunod-sunod.
po eh.
Walang preno, walang break.
Walang preno eh.
Right.
Dapat naman magpreno.
Sabi ko nga, para akong driver ngayon eh. Parang jingle lang yung pahinga eh.
Exactly. Yan lang yung pahinga mo.
Jingle lang talaga yung pahinga. Oh.
Take it easy. Take it easy.
Pero may
Okay lang po yan.
suggestion si Joey kanina. So in PAASE, we would be in a position to get some experts from all over the universities, local and foreign, among our members, to come up with a Coursera type of course, a mini master's course, pero formalize it and make it on a payment basis.
Micromasters.
Micromasters. That's the
Because right now there are a lot of webinars. The problem with all these webinars, you know, people get tired of it. So there has to be a certification. You know, make it formal, really.
Yes.
And your target will be people from the industry, from you know, people working, people who have already graduated. I was talking to Ray Vey about it as well, and he fully agrees with that. No, kasi ngayon, we can design it, and the beauty of it is that we can limit. Not you know, we can. If we can, for instance, partner with the universities para co-branded siya, di ba? Para co-branded. Similar to Coursera, you take a course in, let's say, church history, meron kang, it's offered by Yale. You know? So you can get a certificate from Coursera with the logo of Yale. You know? So if we can do it the same thing here, and we're not even limited to Philippine universities here, di ba? You can have, if we have PAASE members, let's say in a university in the US, you know, that can be one of the things that they can know. So the beauty of this is that it really, you know, it's no longer border specific. And you can have the stuff. Sabi ko nga ho, the universities have one asset which they're not using, which they're not utilizing. And I think those are the star professors. Star professors. You know, if we can pre-record them para may editing, para maayos yung and then they can just attend that same pre-recorded message. It can be repeated on and on and on. But for seminars, they can just present that and then be there for the Q&A. They don't have to repeat themselves. My problem is even I myself do this. No, I keep on repeating myself. I'm getting bored. Paulit-ulit in many of the presentations, di ba? Paulit-ulit na lang eh. So for certain professions, like for instance, biochem, no? O lahat, yung mga natural products, you know, simple things like standardization, you know, characterization, ano ba yung ginagawa dyan, no? So let them, explain it, professors, and then, yeah, and then we keep on, if people want to access it later on, but of course the MicroMasters will have to take exams, you know.
Yeah.
Online exams. It's really open university. Open university is something that ngayon. It would be foolish for any university now not to have an open university program. Yun yung opportunity. Yun yung opportunity.
Yep.
I totally agree with that, Joey. So we will think about it carefully. It's right along our S&T Human Capital Development.
Yeah.
PAASE.
It can get joint, Giselle. so that we can all loop in everyone. Take NAS, sila,
Yeah.
NAS, between NAS, RCP, and PAASE, all
Yeah.
actually curating the coursework. That's covers about 99% of the scientist pool of the field
Yeah.
already. So
Agree.
we're members of all three. So I mean, we can get you all the three presidents basically to say, okay, this is a curated coursework, because that's a problem right now. You have so much offerings in the web, and you have all these different choices. How do you choose? Recommended
Yes.
by NAS, RCP, and
Yes.
plus it's administered in UP or LaSalle
Yes.
or whoever
Ateneo or
wants to
wherever.
participate
diba?
from the Ateneo. Then at least it becomes a unified, curated and validated,
Yes.
for lack of a better word, validated course material. So I think good idea, Joey. And
Imagine listening to a lecture from a national scientist, let's say from DR, Dr. Ramirez, no?
Yes.
On genetics, o halimbawa, di ba? I mean, who will get that privilege, So now expand it. And then we do branding now. Let's, you do brand NAST, meaning really make science at the, make it, you have to market.
And the cost of production, we can
very minimal yan eh. Cost of production.
try to do production.
Oh.
Sige.
And then honorarium lang ng professors. And then merong copyright na yan so that every time we show it, they could, it's like having a book. So every time we show it, there is copyright, we pay a license fee to the professor, man. So it sayang yung mga professors na mahusay So we widen the reach, and they continue to receive, let's say, royalties from those lectures.
I think to get this implemented, Joey, we should start with the sector of industry. So
Yes.
come up with a list of topics and courses that a certain industry, if it is biomedical industry or products industry, we could start with that. Okay? Pero kailangan talagang well organized and well thought out.
We're interested. I'm interested in doing that, with but it's going to be, we come up with a business model. Sorry, I don't want to do it for free sa mga tao. They will have to pay later on. Per participant naman yan Maano yan, no? And very minimal. Like halimbawa, Coursera charges you, if you want a certificate, and you do the exams, etc. They charge you what? $50? $50. That's 2,500 pesos. Diba? You get a certificate. Once you finish, you get a certificate which includes, co-branded with Yale or kaya Stanford or whatever. Diba? Just imagine that, And people people are in the workforce can actually pay for that. That's not a problem.
Okay.
Yeah. So, but Giselle is correct, Joey. I mean, we need user needs or the hair on fire problem. Industry, say validation. It's a common problem right now in terms of treatment. Let's talk about validation. There's Andrews who can talk about a practice, about design control methodology, DA. All of these can be bundled towards a particular customer. So I agree. Let's talk about that forward. Part of you guys.
I'm interested in that. We can initially fund that.
That's another potential.
Merong evaluation yan. Al. So
let's see. I think we're ready to begin.
Yeah. Well, just to let you know, Joey, actually I've taught in the UP Open University. So that's how we do it. Okay? So meron ako.
Yun pala That's a good, may experience na pala
Ang daming mga adjunct professors, affiliate professors.
Yeah.
So that could be
That's right.
Okay, it's 8:15 na.
8:15 ang ate, no? So everyone, welcome to this chat, fireside chat. And our guest today needs no introduction. So further ado, Joey Chave, who is our Senior Vice President of Unilab and head of Growth Leadership Unit 2. President of RightMed Philippines and Chairman of FAREX Philippines Healthcare, is going to talk to us today about his take on vaccine and pharmaceutical sourcing. Joey?
Thanks, Giselle, and good morning, everyone. And thank you for those in the Philippines. Thank you for waking up early to join us. So let me. So this is notes from the trenches. These are some of thoughts that I had. Looking back at 18 years. It's almost 18 years. This is my 22nd year in Unilab. And 18 years I've been sourcing, sourcing and negotiating products for Unilab. So these are some of the relationships that we have. Aside from my function as the overall, the president of all these business units, that includes RightMed, FAREX, Ambika. I also wear other hats. In Unilab, I wear the hat of, among others, regulatory reports to me, legal reports to me, external affairs, of course, reports to me. But the biggest one among the enabler units in Unilab that report to me, and I've been with them for 18 years, is the so-called business development group, which is really more of a misnomer, because it's not really business development as it is sourcing. Sourcing and negotiating the products that Unilab will need to bring in to the Philippines. And this despite the fact that we manufacture here, and I will show you some of the manufacturing sites here. We do manufacture a lot of products here, but in reality, there are a lot of other products that we cannot manufacture here, either because of technology or financial reasons, economic reasons, or it just doesn't make sense to manufacture them. And that's the reason why we have all these relationships with these different companies in order to bring in products fully finished, ready to be marketed once they're in. Let me just remove my my video here, if I remove my video, di mawawala yung di ba?
Go ahead.
Okay. There, okay. Now, if you talk about Unilab, this is 2016 data, but this is still the same. 2020, the rankings, at least the ranking will be the same. So the Unilab Health Group, United Laboratories Health Group, is actually the biggest in ASEAN. Our territory is just really ASEAN. We have no plans of going to the US or Europe, etc. But if you look at this slide, we're essentially competing with multinationals, and Unilab is 100% Filipino owned. So this is a slide that I'm very proud of, because then you have 100% Filipino company that competes with multinationals and actually succeeding in the international arena. This is our geographic presence. We're known by different names in different countries, for historical reasons, In many of these countries, we have manufacturing, like Indonesia, Vietnam, and Thailand. And the reason we have manufacturing there, because when we started in those countries, way back in some of them in the 50s, 60s, or 70s, those countries required us to have a manufacturing facility before you can actually market products there. So there was an active push towards local manufacturing in those countries, And of course, once you have a manufacturing facility, then you keep on improving, expanding. And that's the reason why we have these manufacturing facilities in Indonesia, Vietnam, and Thailand. So if you look at the manufacturing network, we have 9 manufacturing facilities here in the Philippines, the biggest of which is in that pharma campus in Mamplasan. But we also have in Florida Blanca, we also have in Laguna, the other parts of Laguna, Biñan, and several others. Indonesia, we have 3 manufacturing facilities, in Jakarta. Vietnam, we have 1 in Ho Chi Minh, and Thailand, we have 1 in Bangkok. So just some photos of these manufacturing facilities. This is the solids facility. For those of you who have not visited us in Mamplasan, these are the pictures there. This is the solids plant. This is the liquids facility in Mamplasan. This is the newest one. This is in Florida Blanca in Pampanga. This is a soft gel facility. This is a Delta. This is also in Mamplasan. But this is for the small SK, small volume. In fact, if you want to produce experimental, or at least on experimental scale, this is perfect for that. No, especially when you need to produce some for clinical trial purposes only, then this can be a facility for that. Well, this one we just bought. This is really for personal care. We just bought it, and renovated it. This is for personal care, where you have the products of the Myra Group. This is Amuro. This is again, this is a joint venture that we have. We bought into this. We own 51%. I serve in the board. This is within my this is also one of the companies that I manage, I supervise. This is contract manufacturing. Essentially, it manufactures for several principals. This is the one in Indonesia. This is the one also in Indonesia. This is the PT Medipharma facility in Indonesia. This is the one in Vietnam. This is the one of the oldest ones. This is the one in Thailand, which we have not managed. We just renovate. We're not constructing anything new there because it doesn't make economic sense, because the Thai market is very, very, very competitive and everyone is there. So Philippine Pharma, just a snapshot. We have 24% of the market share, and sales of about $1.1 billion last 2019. We don't have the data yet from IMS for 2020. But 2020 was a difficult year for us, and difficult year for the entire industry, which I will show you later. In terms of market share, this is the market share. So Unilever was 24%. Pfizer is the next biggest at 5.5%. I think for 2020, Pfizer's will slide down. I think it's going to be GSK that will be number 2. And primarily, the reason for that is that Pfizer, the established business of Pfizer, which is the one that markets Norvas, Lipitor, this has been spun off into to Upjohn, a new company called Upjohn. It's Pharmacy Upjohn, which they bought several years ago. But they're using it now. And then that has actually merged with Mylan. So that established business is now with that group, Upjohn, Upjohn. So Pfizer is just focused now on the relatively the more complicated products and the newer ones. But on the other hand, and also their consumer products, Advil and other stuff, have been transferred to GSK. So that's why GSK will come out as number 2, expected to come out as number 2 in 2020. The other company there, if you look at it, all of these are multinationals, except for except for 2, Cathay and Ambika. Cathay is a Filipino-owned company, and Ambika is also with us. It's a joint venture with another company. We bought into them 51%. We have 51%. It's actually trading. It's a trading company, so it's 51%, and this is also one of the companies that I supervise, I manage, although I'm not in the operations there, just at the board level, just acting as a chairman. Okay? So every time we have visitors, and normally, suppliers, they will come to us. The first stop usually will be with us, either because they want to partner with us or they just want to get intelligence info or market info from us. Now, and I think this is for many of us who look at the pharmaceutical industry here, these are the things that we need to remember when we discuss Philippine pharmaceuticals. Number 1 is the structure of the market. We are an out-of-pocket market. This is not a reimbursable market. And this is very important because most countries are reimbursable. So for instance, Europe, of course, even within Asia, within Southeast Asia, a number of countries are reimbursable. That's Malaysia, Singapore, The only one which is not reimbursable, I think, aside from us, is really Indonesia. So since most of the countries in the world are reimbursable, every time they come here, and even people who are not familiar with the Philippines and people not familiar with the Philippines, would always think of in a reimbursable market because there are different dynamics in an out-of-pocket market in a reimbursable market. For instance, there is no level, there is no In a reimbursable market, you have a big third-party payer, no? Either the HMO or the state health insurance. In which case, you only have to talk to them. If your product is included in the in the list, then that's it. You're in. Here, it's not. You have to go from one doctor to another, convincing them to prescribe your product. You have to go to the different drugstores, convincing them to stock them, and that goes, that goes on for a long time. So normally the first 3 years, you're not going to get anything. You're not going to, your bottom line will be red probably the first 3 years. And hopefully on the 4th year, you will at least be break even. So that's the situation. That is if you have an aggressive marketing push, of course. The other thing is that patients have no bargaining leverage. It's a collective action problem. You have so many patients, each one has no negotiating leverage. Unlike, for instance, an HMO or a state insurance, healthcare insurance. Then you have bargaining, you have negotiating leverage. But here, none. Patient groups have no negotiating leverage. Nobody has negotiating leverage. But where is the leverage coming from? The leverage is coming from the hospitals and the drugstores. And that does not come in the form of what they're interested in. It's not the lower price, but the discounts that you will give them. So, as a result of the Philippines being an out-of-pocket market, the private market is much bigger than the public market, and for which reason drugstore sales are bigger than hospital sales. Because in a public market, in a reimbursable market, it's the hospital sales because people get their products from the hospitals, from the hospital pharmacy, even the chronic meds and all these things. But here it's not, and that's the reason. The other thing is you have limited purchasing power of your consumers. All this talk, I've always what should I call it? I've always been skeptical about this talk about compliance. The reason for non-compliance here in the Philippines is primarily because the patients take too many tablets, and they want only one tablet, etc. Wait, let me just go back. How do I go back? Are you still there?
Yes, of course we are.
Yeah.
Yes, we are. Yes, we are.
Let me just go back. Let me just go back to that. Napindot ko. So,
Loud and clear.
okay. So, that means, limited purchasing power. So the market is seen as small. If you're a company that does business with reimbursable markets, the Philippine market will look to you as small market, for your product. Why? Because of limited purchasing power by the patients, by the consumers, And this is particularly true with respect to the oncology products, and especially true with respect to the biotech products, like the monoclonals. The Philippines is a very, very small market, almost negligible market for them, particularly for the biotech products, the monoclonals, because people cannot afford them. Unlike if you go to a reimbursable market where, the state insurance or the HMO will pay for you. So, and that is the reason also why we have drugstores. And the role of the drugstores, and the reason it's a very, very critical role and a very powerful one, the role is to break bulk. Because we don't buy in terms of boxes, even for chronic medicines. I mean, you don't buy losartan in boxes. People buy them tingi, And the problem is even with antibiotics, people buy tingi, And that's the reason why we have all these antibiotic resistant strains in the country. So the primary role of the drugstores, if you come to think of it, is to break bulk. Because there is no reason for the drugstores to exist if the patients actually buy, in boxes, because that can be delivered directly to the patients. Now, the next point that I'd like to emphasize is that drugstores and hospitals are the ones with the direct contact with the end users. Pharma companies, they don't, So pharma companies are just suppliers to drugstores and hospitals. you know. And so who owns the, who, you know, sorry, but in business terms, who owns the customer? It's the drugstores and the hospitals, not the pharma companies. And as a result, they have better leverage, you know, vis-a-vis the pharma companies. So let's look at the value chain. The value chain consists of manufacturers or importers, and then it goes to a distributor like Zwillig, for instance. For us, we handle our own distribution exclusively for our own products. And this is why when we were singled out by Secretary Galvez, you know, as Zwillig and Unilab to help the government in terms of warehousing and logistics for the vaccines, you know, we were surprised, and you know, I kept on in meetings with Secretary Galvez, I kept on referring to Zwillig because technically that is not our business. We don't, distribution is not the business of Unilab, you know. So if we're going to do it, but we're going to do it really more of a service, you know, of helping the government on this one, not really a business for us, because we only handle our own products, you know. But unlike typical consumer products, there is a very, very big role of intermediaries here. I put in here doctors as intermediaries, you know, because they're the ones who give the prescription. And in addition to that, you have the intermediary there right at the counter of the drugstore, you know, which is either the pharmacy. It's not the pharmacist, by the way, that you meet there in front of the drugstore. It's actually a sales clerk, a pharma clerk, you know, a pharmacy assistant. That's an intermediary. And that's a source of information as well. So, you know, if unlike, let's say, unlike, for instance, when you go to a supermarket, you make the decision yourself, you just go and direct and get it. In a drugstore, that's different, you know. Of course, they have a grocery, but let's discount that. But when you're asking for a prescription product there in the drugstore, you can actually be switched, you know. If the pharmacy assistant tells you that if they want to push a certain brand, you know, then they will do that. And normally the brand that they will push is the brand that they will have better margins, you know, or their own house brand, their own brand. So it's very easy for them to say, if they want to kill a particular brand, they will just say, you're out of stock. So why, ma'am, sir, ito na lang po, kasi ito out of stock. So those are the dynamics in pharmaceutical marketing and sales. And one must remember, finally, and that's the reason why value is captured primarily by the big retailers, you know. And that's the reason also why the key opinion leaders are very important to the industry, you know, because these key opinion leaders are the ones who convince, who are actually listened to by their fellow doctors. And hopefully, you know, their influence will generate more prescriptions. That's the reality. And then, finally, one has to remember that medicine purchase is essentially a grudge buy. Nobody really wants to buy a medicine. You know, it's not the same, you don't get the same pleasure as you get from, let's say, buying a Starbucks or probably a new cell phone. You know, it's a grudge buy. It's something that you just have to buy, you know, and as much as possible, you want to avoid buying, you know. And that's the reason why you have people taking chronic maintenance medicines, thinking that, you know, doing it twice a week will actually be okay, you know. And that's why you have people who stop taking the antibiotics once they feel well, right? And they do not complete the treatment course. And that's because it's a grudge buy. Nobody wants to buy medicines. I mean, let's accept that. Now, how was it last year? Last year was historically significant for the industry. Why? Because for the first time, it's an entire history, as far as I can remember, you know, the pharma market declined. You know, there was a contraction in the pharma market, and it's negative 3%. This despite the fact that vitamins, you know, vitamins grew by 9.5%. You know, everyone started taking vitamins. In fact, the latest study now shows that vitamin C plus zinc does not really, you know, offer that much protection. Anyway, but, you know, and that's the reason why last year we had the problem with Immune Pro, because we couldn't cope with the demand for Immune Pro, you know. And that's why even for RightMed ascorbic acid, you know, there's a lot of sales loss there because you couldn't cope with the demand. And besides, I didn't want to push it that much because really, ascorbic acid, right by the ascorbic acid, the margin there is very, 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 very small. So it skews, it impacts, it adversely impacts the P&L, because very, very minimal yung margin doon. And the reason why the market declined is primarily because of the prescription market. Antibiotics really took a hit last year. Some companies contracted by 25%, some even 30% because they were focused on antibiotics. The only reason Unilab survived last year was because of the assortment of products that we have. So while our antibiotics and hospital items were hit significantly, at least there were the vitamins and the chronic meds that somehow, got us past, last year. So you will see here, the prescription, the structure of the market is 63% is prescription, 37% is OTC. And what was hit, there was a 9.2% contraction in prescription. So this could not be compensated by the 9.5% growth in vitamins last year. I mean, the push for vitamins last year was crazy. In fact, I was thinking, suddenly Farex vitamin B complex started growing very, very aggressively. I mean, it's the leader in that segment, but I was seeing growth, which I said, why is this growing? Is it even immunity related? And then I just found out that there were some articles that provided that vitamin B complex, for whatever reason, has an impact on immunity. So immunity products were a big in the last year. The only problem was that production couldn't cope with the demand. But this year, we're all expecting it's going to normalize. As people become more comfortable with the virus, as people, become less scared, and in reality also as people become, as the purchasing power continues to erode. And in fact, that focus on vitamins last year, and I've been saying, because I'm a proponent of the universal healthcare, there were things which really, we did think, we have to look at the opportunities provided also by the pandemic, not just the challenges. And to me, the opportunities provided by the pandemic were three at least. Three areas which, when we were thinking of universal healthcare before, three areas which we thought, would be very, very difficult to happen. But they did happen during the pandemic. And let me just cite these three. Number one, because in universal healthcare, what you want is to bring people back to the community rather than to the hospitals. And, hopefully only a small percentage will eventually end up in the hospital so that the, things that can be taken care of in the, that you can take care of in the clinic, community-based clinic can be handled there. And that's precisely what happened last year. We thought before the pandemic, this is not going to happen because Filipinos want, just a sniffle or fever, they go to the emergency room of the hospital. But last year it happened. It was the people started going to the community-based clinics for two reasons. Number one, they're scared of the hospitals. Three reasons I should say. Number one, they're scared of the hospital because they can catch the virus there, COVID virus there. Number two, the doctors were scared of the whole clinic and the hospitals. Even they were scared. So they would rather see patients outside the hospital. And number three, the infection and prevention control measures that were implemented with the hospital, and rightfully so, they should implement those, were seen as inconvenient by the patients. And actually, it's going to cost much more as well because of all the PPE and all the processes that you have to go through. So in that sense, the first element of universal healthcare, which was community-based rather than hospital-based, actually came into fruition last year. Number two is the preventive mindset, which a long time, nobody talks about, nobody talks about, or basically on the curative, nobody talks really about prevention. I tried doing that with the tamang alaga, tamang pagkain, tamang pagtulog, etc. But, I don't know whether people really even noticed it. But last year, this for vitamins and the fact that your only protection really against the virus is to make sure that you're in good health, actually flew. Now the challenge for us is to shift that focus on vitamins to actually healthy living, again, sleep, getting enough sleep. Actually, some of those vitamins you can get from food, so you better eat good food. The only problem, of course, is access to nutritious food. So the preventive mindset is there, and more importantly, the vaccines. Because in any public health intervention, preventive care is much, much cheaper than actually curative. And vaccines do play a big, big role there. Of course, it's clean water, clean environment, hygiene, washing of hands. This happened last year. People are now more conscious of preventive measures. And the third element there, which I thought was very promising, was technology. Somehow, some doctors are using now telemed platforms. Of course, it's very, very limited because they're using that. Most of them are using that, whether it's an app or or they're using it. I don't know. Some are using Messenger and Viber, but the fact is that they're using it. Of course, it's very limited, primarily because they're hesitant to use it to diagnose new patients, which means that if there are remote diagnostics, and there are many off-the-shelf remote diagnostics that can be done and linked with telemed, then telemed becomes really, the use of technology becomes a key feature now in medical practice, in clinical practice, which is, what I'm saying is that you need technology if you want to really achieve the purposes of the objectives of universal healthcare, because it's damn too expensive to put doctors all over the country, But if you have telemed with remote diagnostics, which can be handled, and I've seen this work in India about 10 years ago when I visited India and even Bangladesh, India, you can do telemed. I visited a village, a rural village, which is about 200 kilometers from this urban center. And they were being seen by doctors from the urban center via telemed and with the assistance only of a healthcare worker, a community healthcare worker. Which we have here. You have barangay health workers here, which India actually doesn't even have. They had to train. And here, our barangay health workers are very much trained. So just imagine the patient going just to the barangay health center and seeing a specialist here in Manila through telemed and through remote diagnostics. And remote diagnostics is one area which we can develop here and locally produced here in the Philippines. And this is electronic, just electronic. Now, pardon me for being a little cynical about this calls for manufacturing self-reliance. At the height of the pandemic, people were asking, we need to do, and I kept on getting calls of doing vaccine manufacturing here, or at the start it was PPE manufacturing, mass manufacturing. In fact, we even toyed with the idea, early on, April, I was already exploring the possibility of establishing, it was a very easy technology. It's mask, surgical mask. And we have a partner already. And we were, inaano kami ng partner. It was brought to us by a potential partner. I said, okay. At that time, the masks, I think, were selling like 25 pesos or even 50 pesos per piece. 25 pesos. And he was saying that the production cost would be about 250. And then he was willing to buy at 5 pesos. So the partner would be, because there was such a huge demand in the world that he's willing to buy at 5 pesos, and then he will export that. And of course, our agreement with him only is that, this was a verbal agreement, is that for the Philippines, we want to maintain it here. The priority is the Philippine market, in the Philippine use, and then whatever is left, he can export. So it seemed like a good idea at that time, But of course, I held off for a little bit. I said, but the problem there is once China starts producing masks and exporting masks, everything will fall. All prices will fall. And true enough, how much do you get a mask now? It's 150. 150, 1 peso. You can even get 1 peso Lazada or Shopee per mask. Now, but what people sometimes forget is we do have a pharmaceutical manufacturing sector. And sometimes I don't know whether to feel insulted or to feel pity on people who will always say, no, we don't have pharma manufacturing. We just have is what's this? It's compounding, etc. But that's precisely where pharma manufacturing is. It's in the formulation. It is more challenging to do formulation manufacturing than API. API manufacturing, the active pharma ingredient manufacturing, is a chemical process, you know. And if you're looking at, and the value is not in the API, the value is in the finished formulation, the finished product. That's where the value is. API production, the powerhouse in API production is China. I mean, how can you compete with China there? You know, it's a, number two is also in India. And then you have, you know, no other country actually in Southeast Asia has API manufacturing, especially when it comes to chemicals, the synthetic chemical API production. Maybe you would have a better chance when it comes to biologicals, but synthetic chemicals, you know, for you to really come up with something that is financially sound, you will have to have one product and you supply the entire world with that product. Right? And you're out to compete against China, who will do predatory pricing in order to get you out of the market, which happened in vitamins, in the vitamin C, ascorbic acid, which happened in amoxicillin. You know, and that's the reason why that's the center of because they do the intermediates as well. You know, and that's why the center, that's a center, and they have subsidies. Some of those companies have subsidies. So how do you compete with them? And then they start bringing prices down. So you're left with one big, huge facility here producing, that's capable of producing one product, and suddenly, you know, the market collapses because you know, a Chinese company decides to provide their API at half the price that you're actually at the cost of you're producing it, you know, half of your cost. So you're dead. So please, you know, let's have no, you know, any talk about API production here and saying that there's no manufacturing unless you have API is actually ignorant talk, you know, ignorant talk. And I usually, I just, you know, turn off, you know, because that means that that person doesn't really understand pharmaceuticals, no? And besides, finished formulation is subject to more regulatory supervision than API production. The minute you change even an excipient in the formulation, you'll have to get approval from even an excipient. You have to get approval from, or at least inform FDA about it. So the second point, unlike other countries, and despite all this talk about self-reliance, there are actually no special privileges being provided to local manufacturers. Indonesia, for instance, has PD 1010, you know, which says that, you know, if it's a product is already being manufactured in Indonesia, you cannot import that product into Indonesia. And this is why a lot of companies, foreign companies, have established manufacturing facilities in Indonesia. First, it's the biggest market in Southeast Asia. You know, second, if they establish it there, they can always export to the Philippines or export to the other countries, you know, in Southeast Asia. Whereas if they establish it here, it's a smaller market, plus they cannot export to Indonesia. So it's just the Philippine market. So if you talk about pharma manufacturing here, it's just the Philippine market you're talking about. So inviting foreign companies to do manufacturing here, I think is, you know, suntok sa buwan yan. Suntok sa buwan yan. I mean, why would an Indian company want to establish a pharma manufacturing here when they have economies of scale in India?
Joey,
you know?
we might ask questions because you're saying many important things.
Yeah. Please feel free to ask questions anytime.
Why is that? Government does not allow it? You know, FDIs for manufacturing here?
No, it's not. You know, the government is actually encouraging foreign direct investments in pharma manufacturing. You remember that Pharmazone has been there on the on the top of the list of DTI for about, I think, not only this government, even the previous governments, no? But nothing has happened really. Why? Except probably, you know, because it's not enticing for them to come over. I mean, you have to understand pharma markets, you know, in order to do that. I was telling them that the best bet would be the Japanese companies, you know, not the Indians. If you're going to invite, you have to be very focused and focus on the Japanese companies. Why? Ask them to establish in the export processing zones, no? Ask them to establish it there. Why? Because in Japan, every year, they reduce the prices and they're encouraging the Japanese population now to take generics, no? generic medicines. No? So they reduce prices. Meron silang every year nagbabawas ng presyo yan. Nagkakaroon ng price ceiling every year. No? Binababa na binababa. Now, it's very expensive to manufacture in Japan. Very, very expensive. That's the reason why we don't have a lot of pharma products here which are manufactured in Japan. Even for Unilab, what we did with the Japanese companies is we bought the API from them and then tech transfer, we manufacture here. Right? Now, but Japanese people will not take any medicine that is not actually manufactured, that is not actually being manufactured by a Japanese company. Ganun ka rin. That's why you don't have a lot of Indian companies. You don't have an Indian company in Japan. There was one company, Lupin, which bought a Japanese company in order to be present in Japan. And what they sell there are products manufactured in the Japanese facility. So just imagine, if you encourage the Japanese companies to set up shop here, but primarily for the Japanese market, it will lower the cost. So Japanese market, and then the advantage for us is you will have Filipinos there, in those facilities, being trained. And the Japanese are very good in terms of technology, really, pharma technology, particularly drug delivery, and manufacturing processes. And that's already, aside from the employment, of course, it's the skills transfer. So the government has always been supportive of foreign direct investments. The only problem is, nobody actually is biting, at least in the pharma, in the medicine side. I know in the medical devices, then that's a different thing. If I'm not mistaken, Terumo is doing medical devices here. But medicine, no. So that's no. Now, in fact, if you're manufacturing here, you're even at a disadvantage. It's okay, it's good, and it's perfectly right. That CGMP audits, yung CGMP audits are done periodically by the FDA. That's correct. The only problem is that ikaw lang dito, so you get investments, etc. But foreign manufacturers are not visited. They're not even audited. It was only recently that before the FDA grants a foreign company coming from a non-strict regulatory authority country that they will have to audit. But if you're coming from a strict regulatory authority country like the US, Australia, EU, Japan, you're no longer subject to audit. Desk audit na lang yan. That's what people don't know. Halimbawa, supplements, yan. Supplements, we're so fond of having supplements coming from the US, from European Union, etc. I visited those supplement factories. In the US, there's no supplement registration. It's just notification. And the FDA, US FDA audits the facility only if there's a customer complaint. And I've seen some of them, hindi papasa yun dito sa US Philippine FDA. But we don't visit them, yung supplements, and yet people think that anything that is US, let's say made in the US, is actually better. No, actually you're better off here because the supplements here are being treated like medicines. They even require stability studies here. That's the reason why there are a lot of supplements outside the Philippines that cannot enter, that cannot be registered in. Of course, they're here, being smuggled, being sold surreptitiously. Everyone is here. Even Kirkland is here, right? But what people don't know is they're not registered. Why? Because our Philippine FDA requires stability studies. And none of these people have stability studies, not even in their own countries, perhaps, because it's not a requirement by the US FDA, by the Australian Australian authorities, or the New Zealand, or the European Union. It's not required. So that's the reason, no? So what are the disincentives to local manufacturing? The market, I'm sorry to say, but the market is not big enough, especially for specialized products. Lalo na yung mga MABs, oncology products, etc. The market is not big enough. It's big enough probably for vitamins, for vitamins and some chronic medicines, but only because the market is fully developed already in those areas. Now, there was a solution made, and this was, I was, to a certain extent, I don't know whether they will but this was a solution that I put forward before, and luckily, the FDA at the time, during the time of Miss Nancy Takandong as the DG, she did, no? I said, you need to help pharma manufacturing. Never mind Unilab, we can take care of ourselves. But the other pharma manufacturing here, you need to help them, And the way to help them and to encourage them is to have some sort of a mother-daughter CPR. Kasi some of these manufacturing companies are not really good marketers, So if you just have one brand, one brand that they will carry, and then there's another brand, let's say they will contract manufacture for another entity, and then you will subject that as an initial application again, that will take, that will take time. And anyway, FDA will be reviewing the same set of documents because it's coming from one manufacturer. So why don't we have a mother-daughter one? And the purpose of that is really, people have already forgotten this, but the purpose of that was really to help local manufacturers. So that if you have a pharma manufacturing here and you only produce, let's say, 2 or 3 products, at least you can give it to different marketing companies, and it will be easy, right? That's the purpose. The only problem is, of course, again, noble intentions, but the ones who benefited are not the Philippine manufacturing pharma companies, The ones who benefited are actually, foreign companies, particularly Indian companies. So with one mother CPR, they're able now to give it to several companies here as a daughter CPR, from there. And I must admit that, although we did not do this, we came in much later. This was the model of Mboq. One CPR, it's CPR banking. One manufacturer, several daughter CPRs, and that's given to different marketing companies here. It's except that was not really the intention. The intention was two objectives. One is to declog FDA, which of course never happened. Never happened because I think they still review plenty as if it's an initial application sometimes, Number two, it's the foreign companies that benefited, particularly Indian companies that benefited. The second one, sub point here is regulatory backlog. The reality is that it's a mess. Eric is a very good guy, and Eric inherited a mess. Eric Domingo inherited a mess in the FDA. For we have some applications which were filed 2015. So imagine if you had set up a manufacturing facility here, then nakatiwawang yung manufacturing facility mo, for about 5 years because you don't have the marketing CPR, the market authorization. Now, how long does it take to get a CPR if it's initial application? The for planning purposes, 3 years, but it even exceeds 3 years. Regulatory affairs reports to me. I gave them 3 years as the window for them to get a CPR for initial application. What they got last year? How many percent? 26%. Only 26% of the applications they filed got the CPRs within 3 years. 26%. Now, even things like PLIDP, it takes you about a year. In fact, more than a year, which is crazy because it's the same set of documents. The only thing different is the packaging, yung branding, brands lang ng mga packages. It's crazy. I pity Eric. Eric is a very good guy. He's trying to do his best. He's trying to do everything there. But the problem is it's just really a backlog, a huge backlog there. So we always talk about local sometimes kasi we do a template. Sometimes we think that what is needed by one industry is also the one which is required by another industry. So every time we talk about encouraging foreign investment here in terms of pharma manufacturing, we always talk about, hey, there's a need to provide tax benefits, skilled manpower, utilities cost, infrastructure, we're naturally young, etc. Those are not really the concerns. Those are not the main points. if for decision points for pharma, for deciding whether or not to establish pharma manufacturing here. It's not a tax benefit. It's a tax on medicines is very, very small compared to the value. No? Skilled manpower, we have the skilled manpower here. In fact, the problem is we're losing them to Singapore and to other countries and to Middle East, you know. The manufacturing guys, the quality assurance guys are there. But we can continue. And that's the problem that we have, for instance, for Unilab. Every time we lose somebody, you know, we cannot just poach from another company here because there is no one to poach from. You know? Even Interfil is, I think, downscaling. You know? So that's the problem. So even the heads of our quality assurance, we have to get Filipinos, overseas Filipinos, working in pharma companies there to come back, you know, and to head some of our units in technical. And that's the reason why we have a conscious effort to do banking, you know, technical workforce banking here, you know, so that we get as many people as possible, because some of them eventually we will lose, you know, to Singapore. Once they know it's Unilab, trained in Unilab, then they will just poach. And once they've poached one person, tuloy-tuloy na yan. Kasi he will invite also, you know, a colleague, you know, here, and then sunod-sunod yan, no? So how do we address this? By continuous training and continuous hiring, continuous training. And it's not even utilities cost and infrastructure, because these are small, you know, Philippines is an island, but we have a lot of ways in order to bring products to even the far-flung island. So these are not really the problem. No, they will help if they are addressed, but they're not really the problem. No? So how do you address? Two ways. There are two essential disincentives. Number one is the market size, because we're an out-of-pocket market, and number two is the regulatory. You know, and the first one, we cannot do anything about it at this point unless we have the UHC, universal healthcare, it becomes really reimbursable. But the second one, we can do something about it. You know? And we've been saying that all along, continuously. And I think, but to the credit of DTI, and they've been working with the FDA on this one. Now, go to a more controversial one, knowing the people here. No? So I would say the quixotic push for drug discovery. You know, you can agree to disagree with me, fine. You know, the reality is no one can afford not Unilab. You know, not even companies like not even companies like Cipla, for instance, this is the global leader. Teva was the only generic company that was able to develop its own NCE, which is Copaxone, which has since expired in patents, and for which reason Teva is in big trouble, because they thought they could extend the patent, but they couldn't in the major markets, and that's the reason why Teva is in trouble. No? But the reality is nobody can afford really the R&D on NCEs. When I say R&D here, that includes the clinical trials, because yung laboratory R&D, we can very well take care of that. No? But you have to remember, when we do drug discovery, you have to look at it, the entire pathway, the glide path for that. You know, we cannot stop by just looking at the laboratory and then say, okay, we've identified the candidate molecule and that's it. Well, you know, you have to have a plan in order to bring that to the market, to take that to the market. So chances are you will need to go and touch base, with a big pharma, because only they can actually take care of the clinicals, particularly phase 3 clinicals. And not even the Philippine government. It would be foolish for the Philippine government really to do that, because as we all know, NCS take a lot of time, 15 years, 10 to 15 years, if at all. And it's a huge amount of money that's involved. Politically, I don't think it can be justified. Politically, I don't think it can be justified. And I've yet to see a single, well, unless you're Cuba, Cuba was able to develop yung vaccine niya, for best bet probably would be vaccines, but definitely not the synthetic chemicals. Cuba is now, the lung cancer vaccine. Cuba has done it, but other than that, I've yet to hear of another country that based on government spending. Of course, the initial spend will be probably government, NIH or Cancer Institute or whatever, but After that, they will have to license that out to the big pharma. So I'm not ruling out drug discovery, but it's certainly a pipe dream at this time. And at this time, perhaps when where people are looking for, what's the product, what's the output of the OST and all these things, probably right now we need to focus a little bit more on diagnostics, which are doable here, on science-based natural products. Forget about yung mga natural products na naman na walang science, etc. I mean, that's, first, we're fooling the people. Second, it's a hot, wala yan. After a few months or years, perhaps wala na yan. And then healthcare information systems, which it's very much into IT, that's very, very, and yes, vaccines. Is it doable? Yes, I think so. Vaccines is doable here. Now, there was a time when the hot topic was super generics, bio-betters, we can do, the generic companies can do bio-betters, improve it's a generic, but it's an improved version. It didn't fly. They were talking about chiral generics, etc. It didn't fly, It didn't fly at all. First, you have to show bioequivalence. And this is the problem sometimes that we have. We have the BE. Our BE sometimes provides much better performance than the originator. Sometimes the originator would tweak their formulation, especially those who have been in the market for a long time. And sometimes, of course, efficacy-wise or etc.-wise, it's affected, no? So several instances, we did bioequivalence with the originator here, with our own formulation. Our own formulation actually resulted in better results, better yung kanyang But, is that acceptable? No, because, we have to show that it's similar, it's like, in order for us to even claim therapeutic equivalence. Diba? So that's not acceptable. It's faster onset, but no, hindi, kailangan diba? So yun ang naging problema. Even yung chirals dito, diba, sabi it's more purified version, etc. But, in reality, the doctors don't care. The patients don't care, Especially if you're going to ask for a higher price, for that. Wala. So it went nowhere. I think I hear no one now in the generic sector, not here in the Philippines, but even globally, talking about super generics or bio-betters. It became fashionable for a time. Now, let's talk about herbal medicines here. There are three issues, and I've pointed it out several times. In herbal medicines, it's good to develop herbal medicines. Let's make it seven. But there's regulatory uncertainty. Ano ba talaga yung kailangan, for herbal medicines to be registered as herbal medicine and not just as a supplement? Ano ba talaga kailangan? Number two is the acceptance by clinicians. What amount of clinical evidence? Remember, most of our doctors are, Western medicine. So they will look at how many. They will look at trials, RCTs. They will look at the number. Sometimes they will, not knowing much about how clinical trials are done, they will look at only at the number of subjects. Not knowing, but that at certain times, you don't need a huge number of subjects. So what is the amount of clinical evidence that doctors will need in order for them to accept the herbal medicine? And this is where I give credit to Pascual, for Lagundi and Sambong. And that's why I feel very bad, when I'll be very honest with you, I feel very bad when the royalty rates were increased for them, because they were the ones who actually built it. And I know how difficult it was for them to convince doctors initially. It was very, very difficult for them. So yeah, what amount of clinical evidence? And this is a challenge to the scientist doctors, How do you convince your fellow doctors? What is acceptable evidence for them in order for them to prescribe these herbal medicines? Because if the doctor unless the doctors prescribe them, then that's pointless. Because you can do all the advertising you want. If the doctor says, it doesn't work, patay na yan, wala na yan. And remember Ampalaya, di ba? Ampalaya almost became a 1 billion peso product here. No? And then, the problem is the way they communicated it, and the way people understood it. People understood it as a replacement, not as a supplement, a replacement for their anti-diabetes products, for their metformin and all the rest. No? So what happened? So when patients replaced metformin with Ampalaya, their sugar levels went up. They went back to the doctor, and the doctors found out that they would stop using their medication, taking their medication, and just using Ampalaya capsules. So anong nangyari? Yung the two organizations, on diabetes, which were diametrically opposed to each other, started united and went to the Secretary of Health, Secretary Dairit at the time, and said, you have to put a stop to this, etc. And that's why DOH issued an advisory that it doesn't work. It doesn't work, and you should not replace your medicines with this. So what happened? Down, wala, di ba? Pagsak na yung merkado. Because of the way it was marketed, I think, and even if they marketed it properly, the way people understood it. Remember, and the doctors will be very hesitant. If they already gave you a medicine, doctors will be hesitant to prescribe another one, a supplement for that matter, because it will add to the cost of the patient. So the marketing perspective is important there. And then, of course, the hot pandesal phenomenon. It's luyang dilaw. So you can invest a lot, in terms of, and we should, on science-based, herbals, natural products for that matter. We can do the structure elucidation, we can do the standardization, etc. But when it goes to the market, you're up against people who are actually doing it in the backyard. Ang sabi ko nga, kahit yung mga madre, gumagawa ng luyang dilaw powder. Di ba? So, and of course, they're much cheaper than what you have. Yeah. So, you spent a lot of money on making sure it's science-based, But then again, everyone once people see that, hey, it's picking up, then everyone follows again. And that's the problem of Nata de Coco, the problem of many, many products that we have. When, you cannot control the quality of products in the market until the product itself, creates doubts and eventually is abandoned, even if you have the science behind it with respect to your product. And this is more important with respect to plant products because, as we all know, the microenvironment, makes a lot of difference. So what you have planted in Los Baños is not necessarily the same thing, even if it's the same variety, the same efficacy as what you will plant in Palawan, etc. So yeah, Now, the fourth item here is the necessity of publication in peer-reviewed journals. This struck me in about 3 years ago when we went to Vita Foods. Vita Foods is your global trade exhibition, on natural products, which we have ignored. We ignored for a long, long time. We ignored that because sabi namin na wala yan, wala namang science dyan, it's all natural products. But 3 years ago, we were surprised. They were all talking about science. It's science-based, And there is no way that you can sell unless there's science. And when you speak of science, it has to be supported by publications in peer-reviewed journals. Right? So what I'm saying is that perhaps we need to refocus, a little bit, a little bit lang naman, refocus the way we do things. Let's stop asking our scientists to be entrepreneurs. They will not be, and they're not their core competence. Let's stop the universities from saying perhaps ganito yan, you do this and be entrepreneurial, etc. No. Let's, I think, focus on where they are good at and where they may be needed. Let's ask them to continue to stay in their labs. Let's ask them to continue to publish, but please publish in peer-reviewed journals. And please, if possible, international peer-reviewed journals. And let's help them identify which ones are really relevant for purposes of, let's say, industry. Because that same that same publications that you made in peer-reviewed journals, those are the materials that we, the marketing area, will use. So when we craft the marketing materials will make reference to those peer-reviewed journals. You know, and the market is not the Philippines. The market for natural products is outside the Philippines. That's why our entire business model for Sinovate, the national product company that I supervise, I said, no, for locally developed, and we will be investing a lot. I said, you know, in terms of science. One, in terms of characterizing the, you know, the natural product, the compounds there, you know, and also equally important is investing in the quality assurance and in the manufacturing technology. And then what we will do is we will export this. We will have some for the for the local market, but basically our revenue driver will be the export market. And this is exactly what other companies, I mean, it's not original. Other companies in other countries are doing precisely that. Why is Tongkat Ali, you know, Tongkat Ali of Malaysia, you know, biotropics? You know, they support a lot of the publications. There are a lot of publications, peer-reviewed journals on Tongkat Ali, you know, and that's the one they use for marketing outside. That's why, and they don't market using, they have their own brand, but they market the ingredient. So a lot of and they consider it as the gold standard for Tongkat Ali. So a lot of the products that you find in the market, different brands that contain Tongkat Ali, either as the primary ingredient or as a secondary ingredient or as an additional ingredient, many of them came from Malaysia, biotropics. That's the same way with Peru. Why is Peru? The focus of Peru is maca. You know, all the good maca are there, and they continue to publish maca, Peru. We can identify some of those herbs here. You know, moringa is one of them. Banaba is another. Diba? Maybe we can just focus on a few of the herbs here. You know, on a few of the herbs, and really continue studying and publish a lot of things there. You know, peer-reviewed journals for these herbs, and market them abroad as well. Well, of course, here in the Philippines, of course, making, and then brand the ingredient. That's why for curcumin, you know, what do we have? We're using Meriva, the Meriva curcumin. Why? Because it showed higher curcuminoid level. The higher. However, we found out, you know, and we were collaborating with somebody. This is just a person who's doing it out of, you know, interest lang, etc. We found out actually that his curcuminoid is even higher than Meriva, and much higher. He was able, tinkering with it and able to do the process such that the curcuminoid level is much higher than Meriva and much higher than any of the curcumin products here present in the market now. Some of which, by the way, have very, very low curcuminoid level that are practically negligible. Okay? So again, let the scientists stay in the lab, but please ask them to publish in peer-reviewed journals. It goes, yeah, go ahead.
You have in-house research in Unilab on that
Yeah.
product. You have research in Unilab.
Yeah, for in-house research namin, the way we do it is, I already told them, let us not duplicate what the universities are doing. You know, so our in-house research on natural products is actually on the manufacturing and the quality assurance side. And we're partnering with the universities insofar as the lab aspect is concerned. Like with MSU, Mindanao State University. You know, we're working with them. It's foolish for us to duplicate, and we should not duplicate what the universities are doing and what is being done already with the Tuklas Lunas. You know? Kasi sabi ko ngayon, let the Tuklas Lunas go, universities lahat yan. But we will approach them, and I've asked the OST, ano ba dyan ang tingin niyo pinaka-advanced na, you know, that we can already talk to them, we can work with them, and we can work on the scaling up, on the labs, from lab scale, lab to production. And then importante yan yung sourcing. Diba? Because you have to make sure. So yun ang mga ano eh. So far wala pa.
Ami, she left because Ami is still the head of the technical panel of the whole.
Yeah.
But
So far wala pa. So far I've not gotten anything.
Kailangan
I'll be very
mag-publish.
frank
Wala
with
pa
you.
tayong nakikitang publication. So maybe because you're in the PAASE Council, then you should encourage them to publish.
Well, yes. PCHRD, we're encouraging them to publish.
Okay.
We're encouraging them to publish. In fact, that's one of the criteria. You know, publication. It's just that I don't know how far we have gone to that. Anyway. And the other word, finally here, the scary word that is innovation. We keep bundling it around. Even in your lab, I told them people, I don't want to hear that word, innovation. Anything na lang is innovation. Even small, people get scared of the word innovation because they think about, you always talk about, Steve Jobs and all these things about innovation, etc. As if it's a big thing. You say you sit down and innovation will come to you. In a moment of epiphany, But that's not how innovation really happens. Why can't we start with ang sinasabi ko, I'm a proponent here, and the students, let them copy first. Go to the patent database, copy, let them copy it first in order for them to understand the basics, and then let them improve on what they have copied, which is how innovation really happened. People copying each other and then improving it. So there is no shame in copying, provided you improve on it. And it's not the end goal. It's just to copy. We all know the big patent producers now. They all started as copiers. U.S. copying Germany. Japan copying the West. Korea copying Japan. Taiwan copying everyone else. China copying everyone else. But now, they're already at a stage when they have their own patents. They've moved on. So let's stop using a scary word like innovation as if it's a Steve Jobs moment. It's actually grunt work. Copy, improve, replace components, etc., and so on and so forth. So we're romanticizing innovation. That's the problem. Next, why importation is easier said than done. And this is true of vaccines also. The competition for good quality sources is very limited. Right now, because of here, for instance, for us, we only deal with companies which have certifications coming from strict regulatory authorities. You will hear this often, strict regulatory authorities. These are those with an FDA, Food and Drug Regulatory Authority, which are considered strict globally. So this is US, EU, of course, UK MHRA in EU, no longer in EU. So UK MHRA, Australian TGA, the Japanese FDA. I don't know whether Korea is there, but yes, probably they are because of the PICS. So ito lang strict regulatory authorities. Now, tatawa ko dyan kasi, well, this is, India has many. India has actually the biggest number of US FDA accredited facilities, certified facilities. But it's also a place where you have a lot. You remember there are about 26,000 manufacturers there, pharma, with varying degrees of size and competence. A lot of the big global companies are very, very good, really. But there are still some mom and pop facilities there. Pag sinabi sa'yo, tawa ko tapos sinabi WHO CGMP there, it doesn't mean anything. They're just saying they're complying with the minimum standards, etc., and they're not being inspected. WHO doesn't accredit them, unless it's a vaccine na kailangan mo pre-qualification. So yun yung mga, be careful about those terms there. And the problem there also is if you start just looking at that, many of those companies which are very good as well actually have no such certifications, primarily because those are not their target markets. That's the conundrum here. Because they're not the target markets. Even for Unilab, for instance, we don't have EU certification. We had EU certification before for manufacturing facility, but we never exported to the EU. And the only reason we did that was to make sure our standards are the same as the EU. But we stopped using it. Why? Because now EU requires you to export, to register a product before they do CGMP audits. So we had to stop that. And wala naman kami. EU is not a market for us. We don't have any intention of marketing there. So that's the problem also. So, while it's good that you focus on those with certifications, the problem is that there's some companies who are very good, but not really, and they're out of radar at the moment. outside of radar. Again, market size, when you ask companies to partner with you so that you can import the products, they look at the market and sometimes they see it's very small because they're used to selling to reimbursable markets. Where first year pa lang, they can have a big sales. They can have big sales already. And as I said, limited purchasing power. And the cost associated, this happens often. You have a company who looks at the SRP here, that's of a product, the suggested retail price, and they say, wow, it's very expensive. And true, it's expensive, the SRPs here. It's expensive and we can compete in that market because the SRP is and they can produce it at a very competitive price. Okay, fine. So they will enter the market, no? Just looking at the SRP provided to them by a research agency. Oh, yeah, we're only blank percent of the SRP here, so we can compete, and then they enter, and then they realize, hey, this is an out-of-pocket market. You need to do marketing. You need to go to the doctors, convince them that your product is better than the others. And mind you, even if the doctor is your best friend, he will not. I don't think any doctor will just prescribe your product. He will prescribe others as well, because there are other representatives calling on him. And that's the reality. So you have to spend a little bit on that one. Spend on your medical representatives, and that's the very least. At the very least, and here, med reps, unlike in Vietnam, they need cars. In Vietnam, you can make do with med reps who are on scooters. Now here, no. You have to provide cars to them. And then the other expenses there. And then, okay, you've managed to convince the doctors to prescribe your product. But then again, you have to put it in the drugstore. Now, if you're just if it so happened that the drugstore already a house brand of your product, chances are you will not be accepted. And so where do you go? Small drugstores. Or not only that, if they accept you, they will say, okay, consignment, first tranche. If it doesn't move, we return to you. But by the way, we need this much discount. So how much is the discount? No, it's very common, 35%. They ask you for 35% of your price. Yun na yun. And you cannot naman price high because you're competing with others. And by the way, you have to make price lower than the others because it's for you to move. And I get the 35% discount at the drugstore. These are the big chains. I get 35%, but I expect you to do the demand generation. Because if it doesn't move after a few months, then I return everything to you. Consignment. Or if it's not consignment, you pay for the shelf space. Or worse, ang medicines, normally, ang shelf life niyan 2 years. That's a normal. There are others which are worse, which are 18 months lang. 2 years. Before it gets to you, it's probably already 4 months. And the drugstores will not accept your product if it's less than 1 year, the shelf life. So if your shelf life is already 1 year or less, or less than 1 year, wala ka na paglalagay niyan. Where do you bring them? You try to bring them to the hospitals, take them to the hospitals because immediate use yun. But the hospitals will require you a large discount as well. And that's assuming that you're accepted in the hospital because you have to go to the therapeutics committee for you to be listed in the formulary of the hospital. So by the time, where do you end up? You end up in Bambang. You end up in Bambang. So it's an out-of-pocket market, has so many associated expenses, cost with it, which is, that's why big third-party payers, reimbursable markets, mas mababa yung presyo nila. Kasi may clout eh. And then the company doesn't have to spend on other costs. Binigay ko na sa iyo, I lower the price, tinanggap mo na, okay na yan. And then that's a signal of rin. And then the big third-party purchaser will also take care of signaling to the market that this is a good quality product. Here, you still have to convince people that yours is good quality. And then, of course, the cost associated of doing business in a non-competitive market. The structure of the market is you have dominant players. Well, Unilab is dominant, but we're not exactly in terms of market power. We don't have that much market power because the power relies actually on relies on those who are in contact with the patients, with the customers, which are hospitals and drugstores. We have 18 hospitals, in the mountains, and in many of those hospitals, our products are not even there because those businesses are run independent of each other. So if we're not competitive or we're not able to convince a therapeutic committee that they need another brand in ours, we don't get there. We're not there. The next item is MOQs, minimum order quantities. The reality is that this is production batches. It's batches. So if your forecast is way below the one batch size at least, wala, di ba? Wala ka. And that's the reason why a lot of big companies here with big production batches, they cannot. They cannot, because otherwise you have to buy the entire production batch. And that's going to be expensive. But what do you do with obsolescence? And then, of course, the SRAs and CGMP evaluation, I already said this a while ago, strict regulatory authorities. The reality is that you cannot, and this is important, why? Because it will take you a longer time if you don't get it from a manufacturing facility in an SRA country. Because if it's coming from, let's say, the US, EU, here in the Philippines, by the way, to show you how tedious it is, you cannot go to FDA and just submit your application for drug registration. You have to get a schedule to do that online. And normally you will be given a few months from now, several months before you will be given. And but by the way, you cannot apply for drug registration unless you have the CGMP certificate, which was issued by the FDA as well. And by the way, it takes months also for you to get that. Now, it's faster, but it will still be months, if your manufacturing facility is coming from an SRA, US, EU, Japan, because that will just be a desk audit, but it will take months. Kung wala kang SRA, you're just coming, no matter if it's a very good facility, it's a facility that is all the bells and whistles of an US FDA certified plant, but it doesn't have the US FDA certification, primarily because the company doesn't export to the US. Then that has to be audited by the FDA. And that will take years, at least a year, perhaps, because that will have to be scheduled. And now in a situation of pandemic, when there's travel is restricted, I don't know how that can be done. So it takes years. So you have to file first, ask for a schedule to file, and then you have to get the file for CGMP certification first, which will take months or a year, or maybe a year or two, And then after that, that's the time only that you file for drug registration, and that will take probably 3 years. So that's how long it takes. And by the way, if you set up a manufacturing facility here, you have to have 3 validation batches, before you can apply for registration. So 3 validation batches. If it so happens that your batch is big, that's 3 batches that you're going to throw away. And in the meantime, while waiting for the registration, nakatenga yung planta mo. And that's the reason why our natural products facility, yung Sinovate plant doon, that's why I decided to go into yung the infusion. Because the original plan was really herbal medicines, do there, etc., and then register. But then we realized, how long will it take? It will take years. In the meantime, we have this investment in that facility. No matter how small it is, it's still a significant investment. So what? It will stay there, unused, idle for 3 years. And that's why we had to do something. I said, shift to food. Because food, notification lang yan. So we had the infusion. So sabi ko, kailangan natin ng pangtawid gutom. So we had those botanic infusions. So that refers also to that refers also to the next bullet point, protracted regulatory process. And then of course, okay, you have this, you already have this product here, pasok mo na, ano mo na, okay na sa doctors, okay na sa drugstore, and then suddenly, but you're the only one, you're the only one of that molecule, created the market, but you're the only one, then you're subject to MRP, maximum retail price. Which, by the way, I don't know what the basis is, and they say, and it's not be very transparent in so far as what the basis is for the MRP. It can range for about, 30%, or there was even some products before. One of the products that we had, the proposed MRP was 80% cut. So I said, what's the basis for this? 80% cut. What's the basis for this? Because this is a product that we're manufacturing locally. The API we get from Japan, so we manufacture this locally. I've been looking for APIs that are cheaper because the license with Japan has actually expired about 1-2 decades ago. But we couldn't find any API, which is cheaper than the one there. And this is not a product, the thing with Japanese products, they're not very good marketers. So these are not global products, globally well-known products. That's why the Indians or the Chinese do not manufacture this. But you're asking us to reduce it by 80%. And so what's the basis? Wala naman pinoprovide the basis. Paano na na-compute yun? So I said, well, in that case, we'd rather pull it out of the market because that's not even the cost to manufacture it is not even it far exceeds what they're proposing. Well, the good thing naman about the DOH naman, they listened, they reduced it, hindi na 80%, mga 30%, but still, that's the reality you're faced with. So, yan ang dyan. And it's political also. I mean, let's not kid ourselves. Pharma pricing is also political, And that's the problem with the non-reimbursable market. In a reimbursable market, if they reduce the price, halimbawa, Japan or they reduce or let's say EU, they reduce the price. It's because they're the ones purchasing, diba? But here, when you do MRP and you're not even buying, diba? You externalize the cost. And the problem also, it's not even those who need it to actually benefit from it. The ones who benefit from it are the ones who are actually buying and can well afford the higher price. Diba? So, yan ang problema. Now, sorry, madaldal ako, So, final remarks. What the pandemic has told us is we need really local manufacturing. However, the cynic in me believes that all calls about the need for supply security, they sound hollow and will probably vanish once the and pharma manufacturing survives, but even then, pharma manufacturing survives. Yeah, there are still, of course, there are less and less number. We don't hear of people opening new manufacturing facilities here, at least not for the last 5 years. I've not heard of anyone do, except for our Belmont facility in Pampanga, where the guy is crazy enough to do manufacturing here. And the only reason is because we're a Filipino company. And then we need to identify strategic healthcare products that have to be manufactured here in preparation for the next pandemic. Stockpiles need to be made at the hospital level. And that's the reason why Taiwan was able to respond well dito sa COVID crisis. Why? Because they made a mess, dun sa earlier one, the SARS one. So after that, they said now that all hospitals must now have a stockpile of, let's say, 30-day stockpile of PPEs and all these things, which makes sense, kasi alam mo mawawala yan. And that's why they were able to cope well, But I don't know, once this crisis is done, I don't even hear about stockpiling now. Early on last year, there were talks about requiring stockpiles, etc. But now it has again vanished. And well, to be this is the problem, no? Ito yung, and take the case of PPEs. The CONWEB, this is a confederation of wearable exporters. These are companies producing well-known brands here and are exporting it abroad. So sila yung contract manufacturers for this, their market is totally abroad. They were requested at the height of the crisis and the absence of PPEs to manufacture PPEs here, which they did. They did with UPPGH design. So they did. And guess, so ano yan, assurance yan, we will support you, etc. And guess what? After they've done that, what happened? Wala. We bought PPEs from China. So where do you see them? They're now in SM, and I hope they're really able to sell there, in SM. But the last visit to SM, I didn't see them anymore. So that's the problem. All these calls are actually not, they sound empty. And then we need to provide a fast-track regulatory pathway for locally developed and manufactured products. So without this, all this talk about innovation leads to nowhere, just empty, tiresome talk. I'm really tired of it, And witness what happened to Raul Destura. So, unless all this talk about innovation, about local production, about will not amount to anything unless we get our acts together, and that means also the regulatory, and not just the regulatory, but also lahat, even the market, and there has to be a preference as well. There has to be a stated preference. The reality is that if you locally produce it, it's not going to be always cheaper, but we need to understand that sometimes for supply security purposes, there's a cost to it. And we should be willing to pay for that cost. If all we think about is savings, and then wala mangyayari sa atin dito. Because how do you compete with people outside, who are into it and have economies of scale and all these things? You cannot, and that's the reality. And that's the reason also why the pentavalent vaccine manufacturing here didn't take off, Because I remember the time during of the Dr. Olveda. Dr. Olveda is very, very much passionate about it, and I credit him for that, And this was in the agenda of GMA and even Pinoy, and also in the Pinoy administration, pentavalent vaccine production here. So the very first question is that, if you during the public hearing, I said, if you're doing this for savings, I think you're misguided, Kasi the minute that you have that production facility here, all these companies will do, the existing, remember you're dislodging existing suppliers. The minute you have this vaccine production here, then what they will do is they will lower their price. Yes, they will lower their price because they can easily do that. Whereas you cannot probably compete because it's a new facility. You have depreciation, you have learning costs, etc. And then you have a system where you basically, it's a bidding system where you decide on the basis of price. So, okay na yan, talo na yan, di ba? Wala na yan. And then second, if you're looking at it from a supply security standpoint, pentavalent vaccine is not the way to go. Better to go flu vaccine. Because that's one, because in all our agreements with suppliers, nakikita namin yan, in case of a pandemic and the home government decides not to allow exports of those vaccines, that they are not liable. That is present in all supply agreements, and more so now because of this pandemic. So thank you very much, and I'm looking forward to the questions.
Thanks, Joey. Very insightful talk, citing many of the problems at every stage of pharma. So I'll ask Al to take the lead on taking the questions, but some in the chat box. Just want to recognize the presence of some others. Some have left, okay? But we have here Fred Pascual, we have Tito Alica, we have Lisa Virata. Lisa is with the USFDA, and there are a few others who are around. And I'll just start with the first question. Al, because I'm going to read it from the chat. And this is from Vic Ilag, who's into Vita Foods now and
Yeah,
nutrition.
Vic, that's good.
Joey, sorry, need to sign off to attend another meeting. But his
Sure.
question was, why don't you take the US route for herbal drugs, like you described earlier? Okay. So we had a webinar 2 weeks ago where he talked about it. So why don't we advocate for that with the government?
Meaning no stability studies?
You know,
That's for supplements, huh? That's for supplements, not for herbal drugs, huh? That's for supplements.
We're talking about Vita Foods.
Yeah. We've been talking about it. We've been pushing for it. But you can only convince people.
Yeah.
I don't know, to a certain extent, and of course, every time it's seen as self-serving, of course, no. But I also have naman. Ang ako na yan is, I don't want to go the US route in terms of supplements because there has to be some form of registration, hindi naman pwede notification lang, no? Kasi after all, people will ingest that.
Pero the unfair thing, as you pointed out, is if it's an imported product, whether it's nutraceutical or cosmeceutical or cosmetic, there's just desk audit. They just let everything in without any real analysis.
Yeah, if it's coming from the strict regulatory authority country, I mean, it's pointless naman for them to do audits there, no?
Well, even from
to do audits there, no? Kasi galing naman yan. With respect to drugs, it will be pointless. I mean, kasi we have enough confidence in those strict regulatory authorities, no?
Okay.
With supplements, it makes sense.
Right.
Kasi iba yung batas sila doon compared to our batas here. But in reality, given the number of supplement applications here, it will be virtually impossible for the for FDA to really do those audits. I mean, for drugs alone, they're not able to do it, and they're not able to. They don't have the manpower, they don't have the resources to do it. More so pag supplements. That's why they rely on it's all. We all live in fantasy land, no? So they rely. Anyway, nakalagay naman no approved therapeutic claim. So it's up to the consumers. But that's not how the consumers understand it. In fact, iba pinagawa ni Secretary S.P. Cabral. Secretary S.P. Cabral before was very pinatagalog niya. Kaya ngayon ito ay hindi gamot, hindi nakakagaling, etc. Which is good, no? The only problem is the consumers understood it differently. Ito ay hindi gamot. So they understood it as mas safe ito. You don't understand. We don't, sometimes we live in our own world. We live in our own world thinking that others will understand it the same way that we do. And this is, again, the risk that we face with respect to vaccines. We all understand each other. We keep on talking to each other and we know each other. But iba yung pananaw ng tao Iba ba yung pananaw ng tao? And, iba yung talaga. Simple case, no? Very, very simple. We all talk about generic and branded, etc. No? Hindi naman naintindihan ng mga tao kung ano yung generic at yung branded. There was a time nagpa-dipstick ako. Ano ba yung generic? Ang pagkakaintindi nila. Ang pagkakaintindi nila, generic, pag yan binibenta sa TGP at generic yan. Pero pag binibenta sa Mercury, Watsons, etc., branded. Wala, di ba?
I think maraming tanong yung mga ibang participants natin. Bubut.
I have a comment.
Tito. Comment.
Tito. Okay, thank you very much. Sabi nga, the comments, age before beauty yung sequence, Joey. But I'd like to comment that MediPharma has a very important position in the Indonesian way, because MediPharma was the first foreign company who heeded the call to have a plant in Indonesia, and that was in 1970. Pati
sa Vietnam, we were the first foreign company.
Correct. And like afterwards, because Indonesia had rules about if you want to invest, you must build the plant.
Yes.
And then meron pa isa, Joey, that may nakalagay after 10 years, you must build a plant that will manufacture an ingredient.
Yes.
Diba? So
Yes.
those are, as I said, Indonesia strictly implemented these policies. So
Yeah,
after
yeah.
Medipharma, then
Yeah.
the ang Pfizer,
Yeah.
all the other big US multinationals came in, the Japanese multinationals came in.
Yeah.
That started the pharmaceutical
Yeah.
industry in Indonesia. So again, it's the
It's,
power of
it's-
the first responder.
No. Actually, no. There was no ano yan. First mover. There was no first mover advantage. Initially, perhaps, no.
Yeah,
But
yeah.
now, none.
Yeah,
And basically, kasi Indonesia, if you look at the Indonesian market, it's all dominated by local companies,
Yeah.
Calbe, Sanbe, Dexamedica, di ba? Which is a little different from our structure here. Kasi we're the only one eh. It's
No,
mostly
what I'm saying here, Joey, is that in 1970,
Oh
when
yeah,
this
yeah.
Board of Investment, that was the first rule. I was there. I was in.
Yeah. We were the first one to do it.
So when you were building your plant, we were there. STV was building our office in Indonesia.
Yun nga yung Unilab, the way Unilab does it is that when everyone else is staying away from a country, that's when we enter.
Correct.
Myanmar na.
Joey,
Kaya Myanmar noon. We were there before, long before everyone. Kaya lang, ang problema, sabi ko nga, baka naman pwedeng North Korea. Sabi nila, ikaw na lang pumunta.
Yeah.
Who wants to say something?
Yes,
yeah, okay. A
Who
question
wants
for
to
Joey.
say? Who would?
Yeah. I have a question. You have probably heard of this talk by the OPM priest, si Father Nick, who's trying to develop a vaccine utilizing yeast.
Yeah.
So having heard what you've said, maybe it's better for him to apply for a food supplement thing rather than to apply for a vaccine, because that will have to go through a very, very long, laborious clinical trials.
Yeah.
If he can publish its effectivity,
Yeah.
then he can just apply for a food supplement thing and then have it already rolled out. Because that will
Tapos, that's the reason why both yung sa drug discovery natin, that's why I was very, 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 very strong on that one. Sabi ko, guys, okay naman yung drug discovery. Kaya lang, let's not make it the end all and be all is a drug candidate and then going. Kasi that will take a long time. In the meantime, once we've identified pwede naman siguro ingredient, but do all the published studies there and then supplement, and then herbals until so it's step by step. Kasi para meron ka na, di ba?
I think that's the way to go pagdating doon sa vaccine na dine-develop ng priest. Kasi just looking at the preclinicals and then the phase 1 up to phase 3 trials, by the time it's out, it's probably going to be another pandemic that's hitting us, no? Pero if it's a food supplement, you can immediately deploy, but maybe he should be informed of how long the process of registration is going to take.
Yeah.
For it to be a real vaccine. So as a food supplement, maybe you can have several versions of it at the same time if the delivery mode is actually initiated that way. I think it's going to work.
Alam mo sometimes science is lagging behind the practice, I take the case of tawa-tawa, Tawa-tawa. People are taking tawa-tawa for dengue, Before I was one of those who was laughing at it and say, in reality, it's the hydration. Hydration lang yan. Tapos second, kasi it's the practice You have to remember, that's why you have to situate it in the actual situation, in practice, You have a patient, who's there with dengue, and all the doctor can say is, teka, let's wait until your platelet goes up because tatarga yan But do you think that the doctor would want to just say that and the patient would want to hear that? Na in the meantime, wala akong gagawin, maghihintay lang ako, etc. No, di ba? So, that's the reason why doctors were not stopping patients from taking tawa-tawa, yung boiled tawa-tawa. And patients, parang at least meron nangyayari, meron ginagawa, di ba? Habang naghihintay na yung platelet tumaas. It's the same thing. It's the same thing with COVID now. Diba? If you are asymptomatic or slight symptoms lang, especially kung asymptomatic ka, ano sasabihin sa ng doktor? Wala namang sasabihin sa ng doktor Diba? O stay home, quarantine, etc. Meantime, the patient is under severe stress because he doesn't know whether that will progress into moderate or even severe. So in the meantime, what does it do? Diba? Kaya lumabas yung citicoline. Diba? Citicoline has some studies now regarding that.
I have a comment about the yeast-based vaccine, Bubur.
Yeah.
That would be considered a GMO. Kung nakalagay na spike protein genes doon. Pangalawa, vaccine works with small, hindi yan taken, in continuous doses like food. So that's my comment. Now, regarding the tawa-tawa, Joey, we know there's already Pharmalytics company.
Yeah.
That's
They're
supposed to
doing now. They're doing the clinicals.
Clinical trials, supposedly. Okay? Pero walang disclosure of the actual constituents of herbal. So that seems to be our problem, no? Sa Tuklas Lunas program, sayang wala na si Ami Guevara. She was here earlier. Pero we wanted to know ano talaga yung mga top candidates nila or top products na nila. They say marami na eh. So I think you just need a little bit more openness or transparency, no?
Simple lang dyan eh. Hiningi ko, alin yung advance na tingin nyo kaya na natin ngayon? Wala pa ako natatanggap hanggang ngayon. You know? The thing with tawa-tawa, my problem there is this, no? You know, even before you go into clinicals, you have already to start thinking how it will fare in the market later on. So that's why I'm a proponent of branded clinicals. When you do the clinical, you already brand it, no? Kasi as halimbawa, whatever, Palawan tawa-tawa or whatever. Kasi especially with naturals, pag yan nakuha mo na, wala na yan. Ano na yan? Everyone with tawa-tawa, we'll just use your clinicals. And that's the reason why Meriva, ang kanilang clinicals is Meriva, stays Meriva. Ito yung ano niyan, may specific ano yan. Now, you can do that also for naturals. And ito yung ano niyan, ito may specific, ano yung parameters mo for that, no? Kasi otherwise, look at Lagundi. When we will launch in Lagundi, may clinicals yan. Halimbawa sina Dr. Maramba. But anong mangyayari dyan? The Indians have actually already have the extracts eh. And they came to us and say, kami na lang, we can provide you the extract. If I were just looking at it from that standpoint, I said, okay, akin na, I will launch it here. And basically, riding on the clinicals of the of a near prompt there, etc. But so you have to think it through, brand it, in the same way that probiotic clinicals are branded by saying not all probiotics are the same. In the same way, not all tawa-tawas are the same. Depende, di ba? So it will go the hot pandesal. Unless they do that, it will go the hot pandesal phenomenon dyan. It's the nata de coco all over again and ampalaya, etc. And problems dyan, halimbawa yung ampalaya, do you know that it's not the farmers, the Filipino farmers have benefited from it. It's Vietnamese, it came from Vietnam. Even yung even yung ating ngayon yung itong MX3, hindi naman lahat yan, marami dyan, is imported na yan eh,
It's all imported.
Yeah. Joey, Giselle, my comment ako about the yeast vaccine, so to speak, being GMO. That's okay kasi at least mas madali ang regulatory pathway, I think, no? As a food supplement. Kasi alam naman natin ang regulations ng GMO and of course there's already regulations coming from the Codex Alimentarius. Doon siya papasok. And then papasok mo lang siya as herbal na registration mo sa FDA. So ang kailangan mo lang improve ay bacterial contamination at saka yung presence of heavy metal. So I think mas predictable ang regulatory pathway rather than going through the laborious process of registering it as a vaccine. At least rolled out na agad. And then it's so easy to change whatever construct you have. Papalitan mo lang, this construct is for this construct is for this other thing. Mas familiar ako sa GMO regulations, mas kakayanan natin yun eh.
Yeah. Oo. So depending.
But in vaccines ito, yung vaccine this will continue in COVID yung vaccine. Chances are it will be like flu vaccine, you'll have to take it.
Yep.
Every year. So which makes manufacturing here desirable. So in fact, we're looking at technology partners kung pwedeng dyan, hopefully Novavax.
Supplement, Joey, bubut, iti-take mo yon regularly? Frequently?
Hindi naman lahat eh, di ba? Parang lumalabas.
Hindi ako masyado familiar doon sa bubut So hindi ako familiar doon sa produkto.
Kasi I think
Wala pa. Pipe dream pa rin siya. Ginagawa pa niya. Developmental phase.
strains of the virus.
Yeah.
Magandang mode yon, no? Na you can easily incorporate in the yeast and then culture the yeast, can produce enough of it. Pero as a vaccine, you don't take a vaccine of the same type regularly like a food supplement. So I think that's for me the
You know where we know may immediate wins ka dito, yung madaling wins dito. And I talked to Raul about this, no. In the diagnostic space, no. Kasi ang ano ngayon is you have a lot of RT-PCRs, you know, because of ano ngayon, which eventually hindi yan magagamit na lahat ng ano. So meron ka ng equipment platform, so you come up with a diagnostic test, no, for non-COVID diseases, no, using RT-PCR. Yan ang ano yan. Kasi meron na eh. Ang dami ng RT-PCRs eh.
Sa COVID, medyo minadali. So, hindi talaga nag-meet ng standards at first, yung first design. Okay? Tapos, naunahan na ng ibang cheaper tests, no? But it doesn't mean that Raul should not pursue his platform.
Yeah, he should continue with that, no?
Yeah, exactly. So, that's good. So, for the record, did you manufacture some of Raul's COVID kit?
No, we did not. We just lent him the facility. We were not involved in the manufacture at all. It was him and his team lang. So ito yung this is our natural products facility. Kasi ano yun eh, yung natural products facility namin is that's pharma grade eh. Pharma LTO yun eh. So what we did, we removed the equipment, some of the equipment there, no? And then we let him use it for a time, you know, for several months. He left na no October, I think he already left, no. Went back to his manufacturing facility. It was just we just lent it to him, and that's about it. We had no role at all. No role at all with respect to the vaccine.
As a question,
diagnostics.
Lisa, Virata.
As a question on the chat box regarding filling operations.
Filling.
Yeah. That was discussed, no. In fact, yung proposal noon, in fact, even for pentavalent filling filling na lang dito. But you need to have a technology partner saan mo kukunin yung bulk, di ba? Ideally, the technology partner should enable us to produce the bulk then. No? Kasi kaya naman eh. We have I just erased it then, no, kasi hindi na namin eh. We had a biotech facility in China, in Pudong, no?
Yeah, I wanted to
United Cell. It produces somatropin, which is E. coli based, no. Kaya natin 'yan. But we sold it na. Kasi ano na yan, somatropin, it's a one product, two, including cholera vaccine. Pero cholera oral 'yun, no. So we sold it na because it's becoming more and more difficult to in China, no. But it's okay. I mean, it's namin. At saka our focus is we're going to enter biologicals again, but we want to enter it sana here, no. That's why we're actively we're looking for a biologic entry point here in the Philippines, and we think vaccines would be it, no. Itong COVID vaccine and the others later on. That we're preparing for the next pandemic, not this one.
Yeah, Joey, I'll switch gears with you. Coming from my 20 years in medical device development in the US.
Yeah.
That was my motivation when I came back here 7 years ago to put up a medical device plant. Incomplete. I mean, you don't have gamma sterilization facility. Our FDA is broken. There's no manufacturer capability to certify and validate and verify. How do we go about this if we were to realize?
We have to somehow, I know there are so many challenges, but we have to break the Gordian knot. We need to break it somewhere. I mean, I'm skeptical, and to a certain extent I'm already cynical, but it doesn't mean that I'm giving up. It's just probably made me more realistic, and identifying really, because a lot of people will always approach you and say they do this, etc. But in the end, can you really do it? No. Correct. But you have to break the Gordian knot, and I think it's capable of being, kaya yan. Sometimes you have to manage the enthusiasm of people. Like, case in point. And I think PAASE was involved in that dito. Nung nagkakaproblema ng ventilators, everyone in all my Viber teams, everyone was talking a DIY ventilator respirator. But then I said, guys, remember this is life and death. No, I don't think the hospitals will use a ventilator unless it is approved by the FDA, or unless they not even FDA approval will convince them. No, so saan mo ano yan? Yung ginagawa namin, sabi ko, hindi, don't put it there. Put it muna, halimbawa parang, halimbawa, a transition lang to get to the hospital. Parang it's a device, a portable device that you can, mas doon, di ba? And I think that's where, parang CPAP, di ba? CPAP muna, doon muna. Kasi don't talk about something that will be a matter of life and death kasi hindi gagamitin yan. You have to show more, di ba?
And then the other one is on the Filipino first prioritization in the FDA.
There is no such thing.
No, I mean, I'm saying that pwede ba natin simulan yan?
No. I mean, I don't even I'm not even asking for it. Yung Filipino first, no. It's always such a policy will only boomerang and will backfire, and will actually sometimes later on incentivize mediocrity, So sa akin naman, level playing field, no? Yun lang importante. And then sa akin naman, we need to compete. I mean, I think the success of Unilab also, I'm just basically on the shoulders of the previous guys, no? Because they never, of course, they had some during the Marcos years. So I mean, let's admit it, they had some advantages. But after that, it was really a campaign to really, be on the level and become competing against the multinationals. If you compete against them the best, then somehow it drops on you. And that's what we should target. It's always, okay, how do we compete with these guys, without any preference. However, kailangan lang naman, medyo may konti lang naman. Halimbawa, if you do local manufacturing here, or if it's a local, tulungan nyo naman. Tell us what we will do. Huwag yung nagawa na, tapos pag in-apply na, hindi nahanapin, ang dami-dami hinahanap, di ba? So, guide us, guide the scientists. Kung ako yan, FDA. Okay, let's have a program. I will guide you, etc. I will tell you what you're doing wrong and what you're doing, so that you don't spend a lot of money doing something wrong and later on applying it. I mean, let's disabuse our minds, no? Kasi tayo, we have always said na we want to be impartial, we want to be independent, etc. But guys, in all countries, most countries, Vietnam, Indonesia, India, Bangladesh, lahat yan, no? In the US, they have a preference for their local, no? So at the very least, we're not asking you to bend rules. We're asking you to help them so that they don't go blind. Kasi a lot of scientists are flying blind, really. I mean, I'm sorry to say. They're flying blind. They don't even think about regulatory. That's why sa PCHR they said, unless they realize you do research because you want to comply later on with the regulatory requirements. You don't do research just for research purposes. And you don't, and sasabihin mo later, you will just contest the regulatory. Hindi pwede. You do the compliance. And
Joey,
you should be aware of what
I
is
think I worked the FDA in several evaluations, no. Ang problem kasi mismong FDA, I think, lack the qualifications to actually guide scientists who are trying to get the product through the developmental pathway. Nangyari kasi, nasabihin lang, we are following this European Union type ng stringency ng regulations. And the problem there is actually, the European Union has all the resources to do everything and anything else, including experiments under the kitchen sink. And we never have that in the Philippines. So wala, kung ikaw you're going to go get a product to the developmental phase, to commercialization, wala kang matatanong sa FDA actually.
Yeah, and not only that, this is I'm disabusing the minds even of my regulatory people, etc. Kasi pharmacists, etc. Kasi they look at standards. Sabi ko, guys, standards are not really that independent. Some standards were set up there as an anti-competitive an anti-competitive provision. You know, so when you look at standards, you have to understand what is the rationale behind that. Now, if you look, if that same rationale objective can be met using other ways, then you should be able to argue that, no? Kasi ganyan eh, di kahon eh, ganyan eh, di ba? Ganyan mag-isip, di ba? And then ang view lagi na anything international is good.
Yeah, kaya nangyayari ngayon. Kaya it happens sa diagnostics, it happens in all sorts of introductions dito sa Pilipinas. Pero ang problema nga is to say, you know, research should be complementary to the regulatory process and registration processes. But hindi nga rin alam ng FDA if you started from scratch eh.
No, ganito gawin natin dyan. This is how to break the Gordian knot. In any research, you know, I think there should be a regulatory person. Somebody, meron kang point person doon, and I think this is what DOST I think can provide it. You know? You have to have somebody who has full knowledge and who has the network in FDA to understand regulatory and guide the developers. Ganun lang yan. Kasi we have all this we have the, di ba, we have your technology managers, yung technology transfer which sometimes I find funny, but what you need actually are people to guide the developers, the scientists on the regulatory requirements. And you can get that by
they don't know the science. They don't look at the science.
That's the complete that's the interaction nga eh. You get somebody, a retired person of FDA as a consultant who's willing to learn the science, etc. But the value to you is they will tell you not just what the regulations are, but how the regulations are actually implemented and interpreted. Kasi tayo tinitin lang natin yung black letter law, yung black letter. Yeah. Ano yan? Wala yan. Kasi that's subject to a lot of interpretations, no? In reality, there's a lot of discretion going on in terms of evaluation. Even if you have the same set of, in fact, sometimes nga, we're challenging it. Nasaan yan? Wala naman dito sa regulations yan, sa guidelines. Bakit mo hinihingi sa amin yan? Diba?
Retired na si Lulu.
Si Lulu is the best person to ano that. Lulu
gawa tayo ng consultancy with Lulu.
Yeah, Lulu is the ano.
Si Lulu, Dr.
Santiago. She's very good. She's very good.
Si Ann Villalobos was also being considered for FDA. Okay, at some point. The OST was trying to propose Ann Villalobos.
Oh yeah. As long as hindi. As long as yung meron nanggaling na ng FDA, kasi ano yan eh, madali lang, you know, even a lawyer, you know, sorry, I'm sometimes disparaging of lawyers. Even lawyers can advise you on the regulations sa FDA. But of course, that's black letter law lang, no? Walang ano yan. Eh kahit naman sabi ko, anyone who can read can actually advise you eh. You know? Kaya lang, what is needed there is the insight with respect to how this is actually implemented by the agencies.
FDA, yeah.
You know? And then, I mean, sorry to say, but also, sino yung mga key players doon and who really count, di ba? Kasi, you know, we always have these committees, etc. But in reality, committees are guided by only a few people, di ba?
Okay, anyway, Joey, kasi mag 10:15 na, no?
Oo nga eh.
This has been rich and very insightful.
Yeah.
Pero I really need to make a pitch for herbals and drug discovery, especially in MSI.
Yeah.
And I have to tell you about my compounds, which are all published. So if you're interested, one on cancer, okay, in combination with doxorubicin, another one against gram-positive methicillin resistant, all published in top journals, international journals.
Yeah.
And then a third one against gram-negative. That's very hard to find. Now, I've been trying to get those anti-infectives tested in UP Manila and RITM, and I cannot make headway. Namatay si Dr. Alveda, kaya hindi ko na ma-test sa clinical isolates at sa drug-resistant isolates. So I'm now trying to get through UPM, first through Raul, wala pang nangyayari, so we're trying again. But yung sa cancer, meron na kaming preliminary animal study, mouse study. Now, the way I see it, as you said, there's no way we can move forward on this in the Philippines. So my own strategy is maybe with your help, with Unilab's help, take a look at the data, and then maybe we can try to get to a foreign company. I've always dreamed of an ASEAN ASEAN, drug. And in particular, ACI of Japan is into anti-cancer drugs. They're the ones that came out with the last one from a marine sponge. It is an analog. It is
forget ASEAN companies. There's no point in all this ASEAN nationalism and all these
Japan.
things. No, Japan or even EU, etc. No, so ano yan? So
anong gagawin
India.
natin?
What about India?
alam mo, Giselle, if the data is there, something, of course. This
India.
is off the record, No. This is off the record. If the data is there that it can really help the cancer patients, you just talk to some of the doctors. Kasi, kung makakatingin naman, then convince them. Kasi at that stage, di ba? Especially for cancer patients, I'm sorry, but cancer patients talaga, they're more willing to try it. Diba?
Pero we need the preclinicals. I mean, we don't want to do the shortcut. So we're in the animal testing stage. Now we need to do the bigger animal testing. And then afterwards, yung phase 0, 1, 2, we can go to
basta safety lang. Yung safety, importante lang dyan sa akin, yung safety lang. Yung, kasi yung efficacy, you don't know. Kasi the efficacy naman kasi, it will depend also per person, etc. Basta, I think for doctors, for you to talk, without the regulatory thing, doctors do a lot of things which are off-label.
Okay, so stem cell therapy, syempre, that's all.
It's in their desire to make the patient well. If you can show that it is safe, then at least I think that's the starting point. Now, do you have to go to FDA to do that, etc.? I'm not gonna advise you openly about that, but talk to the doctor, Kasi in many instances, parang tawa-tawa yan ginagawa na, ginagamit na, etc. Diba? So at least meron ka anecdotal. I mean, it's not in the of the clinical studies, etc. But then later on, even when you have enough anecdotal, then you'll have enough people who will be willing to, or companies who will take a second look at it.
On the other hand, you need controlled studies. I mean,
you need that later on. You need that if you're going to do for marketing authorization, etc. But what I'm saying is that if you really think you have something there and it is safe anyway.
So Joey, we cannot skip the animal testing, the preclinical. We cannot go directly to humans. No, hindi talaga napapayagan yun.
No, but at least ang mo dyan, not humans na but based on bang klase yan? Baka naman based on the nature of the product itself, you cannot. Baka naman grass yan, generally regarded as safe.
Herbal. It's a well-defined chemical entity. Isolated from bacterial isolates that we cultured. Okay, marine. The other one isolated from a sponge, but also bacterial in origin, no? So
let me see that, Giselle. Kasi if it's something that people already eat anyway.
No, they don't eat.
No, they don't eat that. They don't eat that.
So yun ang importante kasi yung iba lalo na kung grass naman yan, di ba? Anyway.
This one, the second one.
That will require some human studies there, no?
We also have research, actually PCHRD funded, on moringa. Ang dami ng results na chemopreventive, anti-cancer.
I am very much interested in moringa.
Okay.
We're very much interested in moringa.
Branded. They did not want to support our next proposal hanggang sa nag-retire na ako. And it is moringa from a single origin. So merong geographic indication.
Yes, that's what I've been pushing for also, geographic indication. Otherwise, you get moringa from all over.
The source of it, we're gonna come up with a name, a brand for it. And then let's see what we can do with it. Pero organically grown pa siya, meron na akong analysis ng macro and micronutrients niya pati.
Yeah. I mean, well, if you're interested to partner on that one, I'm interested. No?
Yes. We will work.
Because I've identified moringa.
And you have a role. And you will have a role in it. You know why? We have the powder, but it's not soluble. You need to improve the soluble formulation for the capsule, or even as an additive, say to a milk, soya milk, mga ganon. So maybe we can work on that.
Yeah, brand it, because guys, sometimes we discount the importance of branding, but in reality, in the marketplace, brand is everything.
Okay, sige. So something to think about.
Yeah.
So this has been a close group ito. 9 na lang tayo, no? But I think the people here are the right people. So it's been great, Joey.
Yeah. Thank you.
Great. Al, di ba? Very.
Just to follow, I just wanted to see where Joey's hot buttons are.
Yes.
Clearly, that was one of the first ones I looked at when I arrived here. I work with Connie Ragasa doing NMR on the different solubles and extractables from moringa at different time points, and wherever that's located. We located some hypotensive for lower hypertension. But again, the source and the geographical location and the time of harvest, is it in the meat, is it in the seed inside? So their qualification in that one, and clearly it's worth maybe another shot at the piñata with Giselle there. And
can we work on that? Can I work with you on that one?
Sige.
Yeah, moringa is one. Moringa is one, definitely. Kasi alam mo ganito lang eh. Kasi moringa, why moringa? Ginagamit na ng doktor for lactating mothers eh. So meron na yan eh.
Yep.
Diba?
Yan, tagal na namin we
safety profile.
Proposals for those.
Yeah.
Imagine if we can take that out, and Philippines becomes known. Kasi meron na yan eh, yung gold standard for mga herbals. Philippines becomes known as the standard for moringa. And then you imagine the entire world, it opens.
Pedro Jose.
Kahit ano na lang, kahit lactation na lang eh. Kahit lactation lang eh. Diba?
I even have the design for it. I already have the brand, Philippine Moringa Gold Standard. I have it. I presented it to the NAS 10 years ago.
Yeah.
The other one I want to promote is Sargassum.
Giselle, what Joey's highlighting is for you to be able to be successful in anything, you have to complete technology, regulatory,
marketing,
precisely,
marketing, branding, and then also the pagkakuha ng pera.
Ako interesado ako dyan,
Let's collect
we think, interested ako dyan, but I'm not looking at the Philippine market. Philippine market is icing on the cake. It's the global market. And the thing is, we have a group formerly with sa Unilab sa kanila to, international marketing group. But it was transferred to me as well, to our group. So I have the full, the entire, all the groups needed in order to make it successful. I have the sourcing, the regulatory is with me, the international marketing is with me, etc. And that's their goal in the natural product. So let's work on that. So things, sometimes Giselle, it's a matter of timing eh. You may have sa akin, I don't believe that there is such a thing as a crazy idea or etc. It's just a matter of idea whose time has yet to come. And now I think Moringa's time has come.
I have 20 more years, so until I'm 85, I can keep working.
Well, we continue working.
I want to ask Fred Pascual, who's in the audience.
Hi, sir.
Invested in the algae company. Is this something that you're willing to work with?
Ako, Moringa, let's work on that. If there's anyone interested in Banaba as well, let's work on Banaba. For the natural products. I'm also interested in diagnostics. In diagnostics. So we can do a lot of things. So at the very least, we have we can test it. Maraming pwedeng gawin eh. Maraming pwedeng gawin. Healthcare is at the forefront. Healthcare is in the public forum now, and I don't think it will go away.
Yeah.
Maraming pwedeng gawin. But ang hinihingi ko lang lahat, everything has to be science-based. Everything has to be supported. Hindi pwede na anecdotal, no?
And kung pwede, may approval na sana.
End-to-end. Katulad sa vaccine ngayon, pinag-usapan ngayon na Sec Galvez, di ba? End-to-end. From manufacturing up to the vaccine administration. I think if we do researches, it has to be end-to-end as well. End-to-end. Hindi pwede nang hanggang lab lang. So if the person is capable only of thinking up to the lab level, fine. So let's find a partner for that person who can take it to the next stage.
That's what we're trying to do, trying to get more funding from the PCHRD. And now it's nice because SecBoy already said, kahit na hindi inumpisahan yung research with DOST funding, pwede nilang i-pick up. So I started this Al, before you came in, I was telling Joey about Contulakim G, okay, of Totally, the most
you made me look at it before.
Yes, okay.
Hindi kompleto eh. Hindi kompleto.
Phase 2 na eh.
Kwento. So that's my challenge.
Okay, for pain. Sige.
Yeah.
So,
okay. And saka si Sec Boy at saka si Yusek Gev, you know.
Yeah.
They're all part of the
out, you know, guys, you know, they've been looking for those para sabi nila na medyo sila napapagod na rin na dami na natin sinuportahan, wala namang nangyayari pa nila.
Ayaw nilang i-support yung mga hindi nanggaling sa DOST funding. Yung mga compounds ko, iba yun eh, US NIH funding, iba nun. Yung iba in-house, iba Japan. Tapos ngayon, yung kay Toto, syempre US. Pero ngayon, they are willing to take it on midway or later stage. That's a
complete the team, Giselle. You have to complete the team. Otherwise,
definitely, yeah. So it's going to be part of our MOU, ALE. Okay, so we have an MOU of PAASE and DOST, and this is one of the things. It involved PAASE members, like
the perfect industry mentor. He knows the playing field locally and internationally. He knows the manufacturing. He knows the branding. So
look as well.
Good. Let's form the team on those.
Yeah, wonderful.
So we identified, and let's see how far we can complete it, and then
So
ano lang natin, let's be and let's be creative about it. We need to break the Gordian knot. No, it's we have to start somewhere.
Yeah.
Pwede na
And you know, Joey, this is what Al and I are now really looking more to linkages with the private sector. Yun ang na-realize namin ko sa PAASE na because of our frustration with government, talagang we are linking directly with the private sector. And we already have linkages.
Yeah, okay, we'll be happy to work with you. We'll be happy to work with you. Ang inaano ko lang lagi, and every time I talk to people, sustainability is very important. And the reality, Al, di ba? I cannot anchor sustainability on altruism.
Correct. Yeah.
Diba?
Practically,
it has to make sense for everyone, no? What's in it for everyone?
Yeah.
Kaya nga.
The others have to benefit. So I think thank you very much for your time, Joey.
Thank you very much, guys.
Yeah,
thank you for spending a lot of time. Salamat. Maraming salamat. Thank you. Bye-bye.
5 candidates and you choose one. Ganon. We give 5 possibilities, Al. We line up and then we let Joey say, 2. I'm interested in these 2.
Moringa, I'm interested in Moringa and any diagnostics that will use RT-PCR.
Okay. We can do that actually.
Yeah.
I'll tell you.
And third, I'm interested, Giselle, on the MicroMasters.
All right, the MicroMasters. The courses.
Okay.
The courses, yeah.
Okay.
Yeah. Bye. Thank you.
Bye.
Bye.
May meeting tayo Saturday, ha?
Oh, hi. Bye-bye.
Mag-join ka na ng PAASE, please, ha?
Bye-bye.
Sige, I'll put some time into it.
Aiza will and I will nominate you. Okay.
Okay, no problem.
What?
Okay.
Bye-bye, Al. Thanks so much. Partner?
Yeah.
Bye.